How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, no, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape cause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was balanced on. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
About the work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.
Thank you very much. Good afternoon and welcome to today's proceedings. As members will be aware, we are now practicing social distancing throughout this building, and in the chamber we have removed chairs to make sure that members are sitting a safe distance apart. It's very important that the Parliament continues to function at this vital time, but that we do so whilst observing the very important, the vital public health message of keeping a safe distance. And those rules apply to me here on the podium, so apologies for colleagues on the left-hand side of the chamber if you can't quite catch my eye. It also applies to our Time for Reflection leader this morning, who is being asked to deliver from the Presiding Officer's Gallery. Could I welcome the Reverend Ian May, the Minister of Southleith Parish Church in Edinburgh. Reverend May.
There we go. From on high. There we are. Presiding Officer, members of the Scottish Parliament, thank you for this opportunity to come and address you this afternoon. Recently, I was talking to the students and staff of Leith Academy as they ended their term there in my parish of South Leith here in Edinburgh. I was saying that they need to look after their own well-being, the well-being of their school and the community they live within in these challenging times due to the coronavirus pandemic. In seeking this, I asked them to treat themselves and their physical body with care, to treat their body and what they put into it with the same respect they would have for any special or sacred place. In the Christian tradition, as in most faith traditions, God expects us to do so. In Christianity, we are asked to see our bodies as a sacred temple, a place that is special, that should not be abused or treated with disrespect. This made me think of this special place. This seat of government is indeed a special place. A place, if you don't mind me saying so, is a temple of responsibility, of wisdom, of decisions. What is said in this place, what is decided in this place, I hope and pray will always have a positive effect on those within it, and more importantly, those outside in our community and our nation. If we believe this is the case, what must be done is to treat ourselves, our colleagues, our fellow members with respect. Then as individuals, as a body of Parliament, and those this temple represents, will indeed flourish. So regardless if you have a faith or no faith, we all need to flourish. As members of the Scottish Parliament, I ask you to think about what you will absorb and take in from your debates this day. Think about all you have taken in over the years many of you have spent in this place. Reflect upon the many wise and unfortunate at times unwise words that may have been said in this place. Then use those memories, words, become the body of wisdom and responsibility you're asked to be by those who sent you here. Then I hope and pray that you will flourish, that this special place will flourish, and our nation and all within it will flourish as well. Thank you.
Thank you very much, Reverend May. Our next item of business is consideration of Business Motion 21331 in the name of Graham Day on behalf of the Parliamentary Bureau on the referral of the Local Government Finance Order 2020. Can I call on Graham Day to move this motion? Okay, okay. Could I ask Liz Smith, as a member of the Parliamentary Bureau, to move this motion?
Moved.
Thank you very much, Ms Smith. No member has asked to speak on the motion. The question, therefore, is that motion 21331 be agreed. Are we all agreed? We are agreed. The next item of business is consideration of Business Motion 21332 on behalf of the Bureau setting out changes to this week's business. And again, could I ask Liz Smith to move this motion?
Moved.
Thank you very much. This motion condenses parliamentary business to one day, so we will be meeting today, but we will not be meeting tomorrow or the next day. Are we all agreed? Sorry, the question is that motion 21332 be agreed. Are we all agreed? We are agreed. Now, the next item of business is a statement by the First Minister, Nicola Sturgeon, on the coronavirus COVID-19. The First Minister will take questions at the end of her statement. In fact, I believe she'll be followed by a statement from the Cabinet Secretary for Health, Jean Freeman, and then the First Minister and the Cabinet will take questions on COVID-19. And members who wish to ask a question to press their request to speak buttons as soon as possible. And I call on the First Minister.
Thanks, Presiding Officer, and thank you for the opportunity to give an update on our response to the COVID-19 pandemic. First of all, I can confirm that as of 9 o'clock this morning, there have been 584 confirmed cases. That's an increase of 85 from yesterday. As always, let me be clear that these numbers will be an underestimate. It is also with sadness that I can report that there have been a further 2 deaths of patients who had tested positive for COVID-19, taking the total number of deaths in Scotland to 16. I want to extend my condolences to all of those who've lost loved ones and again thank our NHS staff who continue to care for people suffering from the virus. Cabinet Secretary for Health will provide more detailed briefing in a few minutes. But I want to begin with an update on some key points. As everyone knows, last night we announced significant new measures to slow the spread of COVID-19. Let me quickly reiterate what these are, because I want people across Scotland to be very clear what is now expected of all of us. Effectively, Scotland is now in lockdown. People had already been told that they must stay at home. We've now set more stringent limits to that. So the only permissible reasons for leaving your home are as follows: to shop for basic necessities, but only once a day at the most; to take exercise, again, no more than once a day, and this should be done alone or with your household, not in groups; for medical reasons for yourself, or if providing care or to support a vulnerable person; and to travel to essential work if that work absolutely cannot be done from home. All social events are now banned, and public gatherings of 2 or more people, excluding households or for essential work-related purposes, are also prohibited. Communal places such as libraries and playgrounds must close. Places of worship should also close, other than for funerals, which I'm deeply sorry to say must now be restricted to immediate family. I know that there have been some questions about families who live apart. Children under 18 can continue to move between households, but they should, in doing so, take hygiene and social distancing precautions. And I also want to confirm that those who have caring responsibilities or who work in care should continue to carry out those responsibilities, but again, should follow social distancing measures as much as possible and hand hygiene at all times. But the overall message is very clear: people must stay at home. I know how hard this is for everybody, but people should not be meeting friends. They should not be meeting family members who live outside of their home. And as I have said previously, for all of us right now, life should not be feeling normal. If it is, then you're almost certainly not sticking to the rules that we are asking people to abide by. I'm confident that the vast majority of people will comply with these rules, and I want to thank everyone in advance for doing that. However, later this week, the emergency legislation that Parliament will discuss shortly will give us powers of enforcement, and I want to be very clear, we will use these powers if necessary. I want to say a bit more about the implications of the current situation for businesses. Since I addressed Parliament last week, the UK Government has taken helpful and very significant steps to support wages. I know that doesn't come into force until the beginning of April, but I hope that by working with lenders, businesses will now be able to do the right thing and not lay staff off unnecessarily. I can also confirm that the application process for the Small Business Grant Scheme, which was announced by the Finance Secretary here last week, is now live, and details of how businesses can access and apply for that are available on mygov.scot. I can also assure self-employed and freelance people that the Scottish Government continues to argue for the UK Government to put in place support for them, and the Cabinet Secretaries for Finance and the Economy wrote to the Treasury on that matter again yesterday, and I'm very hopeful from the signals given by the UK Government that we will see positive announcements on this soon. If I can now turn to the issue of work and the closing of business premises. And let me start, Presiding Officer, by acknowledging the very acute challenges that businesses are facing right now, and also thank the vast majority for the very responsible approach that they're taking to protect the health and well-being of their workforces. However, I know that there remains some concern that businesses and employers don't know what advice to follow, so I want to be clear today about what the Scottish Government is expecting. And firstly, I want to stress that it is employers who should be making these decisions. It should not be up to employees to anguish over whether or not they should be going into work. And I would also say that, as I'm sure people will appreciate, it's not going to be possible for us to make a decision or offer bespoke guidance for every single different business in Scotland. This is difficult for everyone. But the guidance that I'm about to set out, when you strip it back, I hope will help businesses navigate these difficult decisions. It is clear that there are categories of business that have already been told to close. On Friday, that included pubs, restaurants, cafes, cinemas and gyms. Yesterday, we published a list of essential and non-essential retail. Non-essential retail premises are now required to close, and of course shopping for basic necessities kept to a minimum. That list is being updated to include other forms of establishments and those critical for civil contingencies. In particular, it's important that key strategic sites vital to economic resilience and which can't be easily shut down, for example the steelworks at DL, can continue to work so long as they can maintain the minimum number of required staff and the social distancing requirements. However, I am aware that there will be many businesses out there that don't fit neatly into any of those categories, manufacturers and food producers, for example. For these businesses, the advice, which is very much based on a precautionary principle, given that our priority here is the protection of health, is broadly as follows. Firstly, if your staff can work from home, then that is what you should allow them to do. Secondly, if your staff cannot work from home, you should be asking yourself if your business is contributing something right now that is essential to the fight against coronavirus, for example, making medical supplies or manufacturing essential items, or is it contributing something essential to the well-being of the nation, for example, food supplies? If it is, we want you to keep going if possible. But the questions you must ask yourself is, can you operate your business in line with safe social distancing practice and, of course, your normal health and safety requirements? If you cannot answer yes to those questions, then in our view, you should not continue to be open. We've been asked specifically about construction sites in Scotland, and our advice right now on the basis of that precautionary principle is that we would expect them to be closed unless the building that is being worked on is essential, such as a hospital. We know that for some people, for example, self-employed gardeners and window cleaners, where there is no contact with other people, if they can go about their business safely, then this can be good for the community, and we would encourage them to do so. For the many people who are looking to volunteer and help out in their communities, there is advice available on readyscotland.org on how to do so safely. It will, of course, continue to be vital that local authorities put in place arrangements for the children of key workers and vulnerable children. The teachers and other education staff who are providing this service are themselves key workers, and I want to thank those who followed the advice so far, and in particular all those parents who are now looking after their children at home, and the teachers and early years workers who are caring for vulnerable children and those of key workers. We will have indicative numbers on attendance later today, but our initial reports are that the vast majority of parents are not seeking to send their children to school. And finally, Presiding Officer, Parliament, rightly, as you've just indicated, is also changing how we operate. Although, and I want to make this point very strongly, all MSPs must continue to perform a very important scrutiny role in a time like this. I understand it has been agreed that until the Easter recess at least, Parliament will now only meet for 1 day per week rather than 3. Presiding Officer, I want to conclude with a basic point. The measures that have been announced in recent days, from the school closures last week to last night's lockdown, are really, really difficult for every single individual and business and organisation across our country. And they are truly unprecedented. But they are unprecedented for a reason, because the challenge we face is also unprecedented. As I've said before, this is by far the biggest challenge our country has faced in our lifetimes. And so the measures we take to deal with that and to seek to mitigate its impact must reflect its magnitude. The changes we're asking people to make to their lives, difficult though they are absolutely essential. They are essential to help us slow down as much as we can the spread of this virus. They are essential to reduce its peak impact. They're essential to seek to avoid our NHS becoming overwhelmed so that it can instead continue to provide treatment for all those who need it. And they are essential to save lives. The daily reality we face right now is quite a stark one. If we all comply with these measures, then many fewer of us will die of this virus than would otherwise be the case. That means many more of us will come out the other side of all of this, and perhaps more quickly than otherwise be able to resume the lifestyles that we have for so long cherished and taken for granted. So for now, I hope we all show solidarity for each other, even as we stay apart, by staying in touch with those we care about and by helping each other as best we can. But let's be clear, crystal clear, collectively as a Parliament, that staying at home has become the only way of slowing the spread of this virus, the only way of giving our NHS the chance to cope, and the only way of saving lives. And that must right now be the priority of each and every one of us.
Thank you very much, First Minister. I call the Cabinet Secretary for Health, Jean Freeman.
Thank you, Presiding Officer. Presiding Officer, this virus doesn't spread on its own. It's spread by people. So what needs to happen is absolutely clear. Please stay at home to save lives. To save lives, to protect our health and social care services, to avoid unnecessary deaths. The response of our health and social care staff has been extraordinary. Every single one, from consultant to cleaner, from carer to nurse, to driver, to maintenance worker, to paramedic, is vital. Every single one of them matters. We owe it to each and every one of them to stick to the rules and stay at home. Even with the unprecedented measures now in place, we will not escape the impact of COVID-19. Having placed Scotland's NHS on an emergency footing, we have now received the mobilisation plans from all of our health boards. They set out in detail how they will maximise intensive care capacity while seeking to maintain essential services such as emergency, cancer and maternity care. We are well advanced in our work to double our ICU capacity to 360 beds. Facilities have been repurposed, staff are being trained and beds are being freed up. Our response to double ICU capacity is the international standard in response to a pandemic. But given the scale of the challenge, we are now planning to quadruple our ICU capacity to over 700 as quickly as we possibly can. A pipeline of ventilators is slated to come to Scotland over the coming weeks to enable this increase, and we are working with suppliers to do all that we can so that they can be brought here as quickly as is humanly possible. We're also mobilising our community services with a new community pathway for COVID-19. From yesterday, people with symptoms should not call their GP practice. People with symptoms should first seek advice from NHS Inform. They should be staying at home for 7 days. Only if they don't get the advice they need or their symptoms deteriorate should they call 111. Callers to 111 helpline will be assessed and called back by new local community hubs if that is clinically required. In each hub, senior clinicians are ready to take the calls. In some cases, patients will need to be seen face-to-face. COVID assessment centres are being rapidly deployed across the country with an initial 50 planned this week. This new dedicated pathway frees up our GP service to continue delivering important non-COVID-19 healthcare to patients. But it isn't just our NHS that is integral to responding to this virus, so too is social care. With COSLA, integration authorities and providers, we're working to prioritise social care support to the most vulnerable in these circumstances. Frontline social care workers are key workers who will have access to childcare if necessary to carry out their critical roles. A triage centre through NHS National Services for Scotland for urgent supplies of PPE for registered social care providers went live last week and has been taking hundreds of calls and delivering thousands of face masks, disposable aprons and disposable gloves to providers across the country. Targeted and clinical advice for nursing and residential care residents and COVID-19 has also been produced and is now also available from HPS. Yesterday, with Councillor Curry, who is the COSLA lead in health and social care, I wrote to all local authorities setting out my agreement that the costs of additional social care would be met. That is important, and it is an important assurance that people who require vital social care support should not have that removed to cope with the COVID-19 challenge. We need to ensure our health and care workforce is safe and protected, so we're working to procure and distribute necessary supplies of the types and levels of PPE required to safeguard frontline health and social care workers, and we now have a clear distribution work streams and clear advice and daily updates to our boards and to those other parts of the service that we are providing. It is essential, however, that frontline health and care staff can remain at work. To help save lives, we must continue to prioritise testing in hospitals. All the capacity that remains must be used to ensure that critical staff can return to work as soon as possible. Today, I'm publishing guidance for the NHS to support the use of the testing capacity in our laboratories that is not needed in terms of providing essential care, so that it can enable health and social care staff to be back at work when it is safe for them to do so. NHS boards will prioritise testing based on where the pressure is being most felt in their workforce and in social care. As well as our own work to rapidly scale up testing in Scotland, we are working closely across the United Kingdom to increase testing capacity significantly. And I can advise the Chamber that an announcement on that is due shortly, including Scotland's role in that effort. Presiding Officer, there has been a tremendous response to the call made by the Chief Nursing Officer last week for nurses and other health professionals to return to help in the present emergency. By yesterday, there were nearly 3,300 individual queries. People are contacting our National Recruitment Hub on 0141 278 2719 and making direct contact with their health board. In addition, all final year nursing and midwifery students will be put onto a placement for the final 6 months of their degree programme, which will enable them to undertake paid work in the NHS during this period and still complete their degrees on time. Final year allied health professions and biomedical science students will complete their clinical hours and then will be able to go onto the emergency register and be deployed in the workforce. Second year nursing and midwifery students will also have their education changed so that they can undertake paid work in health and social care settings throughout Scotland whilst continuing with their courses. Discussions are ongoing on the use of second and third year allied health professional students, but I hope that we can agree similar arrangements. And all first year students will be able to undertake paid work if they wish. And I very much welcome those medical students willing to volunteer to support our services at this time and the steps taken by the regulator to support their entry onto the register. We will ensure that all of these volunteers are deployed in the safest and most appropriate way. I'm sure that every single one of us here is truly grateful to all of them for stepping forward to serve us at this time. We cannot have barriers to staff working in the NHS. Last week I said that I would act, if I could, to remove parking charges from those PFI car parks in our hospital settings. So from Monday the 30th of March, car parking charges will be removed from Ninewells Hospital in Dundee, Glasgow Royal Infirmary and the Edinburgh Royal Infirmary for the next 3 months. Presiding Officer, given the figures that we know we are dealing with, it is even more critical that we protect and support the people in our communities who are at the highest risk. That is why we have asked the 200,000 or so people who are at the highest clinical risk from COVID-19 to self-isolate for the next 12 weeks. This includes being as far as possible from other members of their household. This group includes people who have received solid organ transplants, have specific cancers, have rare diseases, are on immunosuppression therapies, or have severe respiratory conditions. That is incredibly hard for them. We are therefore writing to these individuals, setting out what they and their families need to do to stay safe and how they will be helped. Many people will have family and friends who can support them over the next 12 weeks, but others will not. For those people, we are putting in place a package of support. To coordinate this work, the Deputy First Minister has ordered the establishment of a humanitarian assistance centres across the country as soon as possible. Working through GPs and local resilience partnerships, we will provide help with managing medical conditions, arrangements for delivering medicines and services, including carers. Crucially, it will also include grocery deliveries through a new national contract which is currently being negotiated. Presiding Officer, the key to saving lives, to avoiding unnecessary deaths, is for all of us to comply with the measures set out by our First Minister and across the United Kingdom. I know it is hard. I know that life seems unsettling and strange. But it is vital that we all accept now, today and tomorrow that that is how this must be. That is how all of us honour the hard work of our NHS and social care staff. That is how we go beyond warm words and really, truly thank them for their courage and their care. We stay at home and we follow the rules. Thank you.
Thank you. The First Minister, the Health Secretary and the other members of the Cabinet who are all present will be willing to take questions now. Jackson Carlow.
Presiding Officer, can I, on behalf of my party, add our condolences to the families of all those who have suffered bereavement since last week. As both the Prime Minister and the First Minister have made clear, we are living through a national emergency. The clear duty borne by us all is to accept and apply the advice we are given. Where clarity is required, to seek that clarity rationally. Where detail yet remains to be made public, to accept that that detail will be forthcoming. Our leaders here in Scotland, just as at Westminster, are all applying themselves with every endeavour to steer the country through this crisis. They need our support, our forbearance and our gratitude. But that is as nothing to the debt of gratitude we owe to every last one of those working in our emergency services, but above all in our NHS, where they are working, where indeed others are now volunteering to return to work, all to keep us safe. Now, last Friday, I endured an exploratory procedure at Glasgow's Victoria Hospital. Thankfully, all was well, but more appositely and in the most humbling of ways, NHS workers approached me to say, "We will not let the country down." Presiding Officer, I never doubted it, and I'm so very proud of every one of them. But that pride in all those working in our National Health Service, a pride I hope felt by every last man, woman and child in Scotland, deserves to be backed up not just by our words, but by our actions. So let me repeat, stay at home, abide by the guidance given. It's common sense. And while it's true that the problem with common sense is that it's not often so very common, so people should listen and listen good. Stay safe yourself, protect our NHS and help save lives. Presiding Officer, can I ask the First Minister to do all she can to work in conjunction with the Prime Minister to ensure we achieve the maximum clarity and, wherever possible, a consistency of messaging. Now, more than anything else, people are seeking clarity, and I know both governments are responding to evolving events, but any confusion in messaging is naturally unhelpful and is a source of many inquiries which could be rendered unnecessary. Today, that centres on who should be going to work, and particularly those in the construction sector, with both the Prime Minister and the Secretary of State for Housing, Communities and Local Government giving slightly different, it seems, emphasis on whether or not those in the construction sector should be going to work. I understand from my own local authority, East Renfrewshire, that the uptake at schools by critical workers has been low and manageable. However, I know too that the variable sector inclusion on the key worker list between Scotland and the rest of the UK remains troubling to key sectors in Scotland, and in particular food processing, distribution and agriculture, as does the further variable application by individual local authorities. Now, our priority must be have as few children at school and only as a last resort. However, can the First Minister update the Chamber on the current uptake and the discretionary position across Scotland? And finally, there are a myriad of issues, for example, those with vehicles needing immediate MOTs, the burden of compliance with FOIs on local authorities with reduced and refocused staff complements. Can I ask the First Minister where general inquiries of a practical consequence in relation to other issues should be directed? Presiding Officer, as Churchill once observed, it is not enough to do our best, we must do what is required. In closing, can I offer again the support of my party to the First Minister and her colleagues as they do what is required?
First Minister.
Can I thank Jackson Carlow for his comments, his exhortation to the population to follow the stay-at-home advice. I think it is important that all of us consistently, coherently and unequivocally advise the public to do exactly that. A number of points of detail have been raised there. I'll cover them as quickly and as generally as possible. If there are points of detail I don't cover here, we will come back with a detailed answer later on. Can I say, in terms of the NHS, as the Chamber knows, I spent 5 years as Health Secretary, and I feel this as First Minister. There's not a day goes by when I'm not in awe of the contribution of those in the front line, in particular of our NHS, but everybody who works in our health and social care services. But I am acutely aware every day just now that we will never owe them more than we owe them in the weeks to come. I want to make sure that as government we are doing everything we reasonably and possibly can to support them. That's why the car parking charge announcement that the Health Secretary has made is so important as part of that. There have been issues, I understand, but we are working hard to resolve around the distribution of protective equipment. And these are just examples of how we will absolutely do everything we can to support our frontline workers. And most of us will be able to cite examples of this. My own sister works in the front line of the health service. She was in a hospital ward yesterday morning. She was in a hospital ward this morning. She'll be there again tomorrow morning. So I know firsthand the pressures that they are under right now, and I know my responsibility and that of the government to support them. But the thing we can all do to support them most is to follow the advice, because that is what will help to, if not eradicate that pressure in the weeks to come, then keep it at manageable levels so that the people who need treatment can get it. Secondly, on coordination across the UK, I think I know we're working very hard to do that, not just the Scottish Government, the UK Government, the Welsh and Northern Irish governments too. And I think we are being very successful in coordinating both our response and our messaging. The response overall is the same in all parts of the UK in terms of the advice we're giving to the public. Last night on the COBRA call before the lockdown measures were announced, we agreed to coordinate the timing and the content of our messaging, and I think that is important. I've always said, and I think people can understand that, there will be operational differences because the structure of our NHS is not the same, so the way in which we're contacting the most vulnerable people will be slightly different. And also, we have a responsibility to make sure that the overall approach is being translated into the advice we think is appropriate. I can't speak for other administrations on some of those operational issues. We will try to make sure it's as consistent as possible. But on construction, for example, my judgment, based on the advice I have, is that right now the safest, most precautionary principle is for construction sites not to continue. We have undertaken to look at whether there is a guidance that could be put in place for the safe operation of construction sites, taking all of the social distancing advice into account. And if we think that is the case, then of course we will share that and amend that position if we think it is appropriate. So we will continue to be as consistent as possible, taking account of those operational differences. Similarly on schools, we have to remember why schools are closed right now. It's for a health reason, because the experts have told us that it helps delay the spread of the virus not to have large numbers of children congregating together. So we defeat the purpose of that if we then have large numbers of children congregating together in other ways. So we've had to be very rigorous about key workers and vulnerable children. The priority has to be those in the front line of the NHS, but we have said we will seek to accommodate others as and when we can, based on a rigorous prioritisation, and there is a brokerage function that the Scottish Government is applying there. I said in my statement we don't yet have figures for uptake, but when we do, we will share those. But our evidence so far is that the vast majority of parents have not been sending their children to school, and therefore that may give us some more, but it will be limited capacity to look at other areas. There were some points made about, I think, FOIs, which have been covered in our emergency legislation, and the point about general inquiries. I will endeavour and undertake to give some advice to MSPs, particularly when we're not sitting as often as normal, about the best route for inquiries and for questions, and indeed for the many offers of help that I know MSPs are getting from across their constituencies as well.
Thank you. Richard Leonard.
Thank you, Presiding Officer. And can I express the condolences of these benches to those families who have lost loved ones through COVID-19 in the last few days. I also want to say that at a time of a national emergency, we think this national Parliament should not go into Easter recess, but that we should continue to scrutinise what is happening in the midst of this emergency. We think that is our job, and we genuinely think that is what the people who sent us here would want us to do. So I would ask all parties to consider whether we should go into recess or not. We do not think that we should. I want to pay tribute again to all of those NHS and social care workers, not just for what they have done, but for what they are about to do. Nobody knows what the future holds. It is unwritten, but one thing is certain. We will all be reliant for our health, for our safety, some even for our lives, on their skills and their judgment. We will all be forever in their debt, which is why now more than ever we must give them our total and unflinching support and recognise and so exercise our full duty of care to them as they exercise their duty of care to us. We must listen to them, to their calls, and so give them the best personal protective equipment when they need it, which is now. We must give them the reassurance of access to testing in case of any symptoms. And because many of them are out working in the community, home care workers, community nurses, ambulance crews, can I ask the First Minister, can I implore the First Minister to give them an undertaking that you will reconsider the case for community testing, the case made by the World Health Organization, the case for community testing and so tracing and tracking to help slow down the spread of this virus, to keep people safe. First Minister, will you hear this call?
First Minister.
Can I thank Richard Leonard for his comments and for all these questions? Can I take them in turn? Firstly, it's not up to me when Parliament sits, it's up to the Business Bureau when Parliament sits, and I'm not expecting to be having an Easter recess, so it, in a sense, makes no difference to me whether Parliament is sitting or not. I'll be working, as I'm sure all of us will be. But our practices must reflect the guidance that has been issued to the general public, and I think today they do. Cutting down the sittings this week, I think, do that, and I'm sure that will be kept under review by the Bureau. But what I would say, and I've said this consistently, and at a time like this, absolutely, you come to understand even more than you do normally how important the function of scrutiny is. You know, we are living through unprecedented times when we're asking people to do unprecedented things. In a democracy, there must be some scrutiny of that. There must be rigorous scrutiny of that. I said last week, and I will say again, we're trying to think of everything in government right now. We're trying to make sure we've got all bases covered, but we will miss things, or there will be things that we're perhaps not doing as well as we could. So the questions that are coming are really important. So all I would say is the way that scrutiny happens has to change because of the guidance that is out there, but the fact of the scrutiny doesn't have to change, and if anything, it is more important than ever, and I mean that absolutely sincerely. In terms of the points about the NHS, the duty of care that we owe to NHS staff is one that I feel acutely and personally every single day, not just during these periods, but particularly during this period. We are listening, so there were concerns raised about the ambulance service and PPE. The Health Secretary met with the ambulance service last week to resolve those issues. We will do that systematically. If there are concerns being raised in this difficult, challenging, uncertain period, we will address those as far as we possibly can. The issue of testing, I want to come back to this because the way we slow down the spread of this virus is by staying at home and following the advice. We are ramping up testing capacity, but we have set 3 key objectives for our testing capacity, and they are the right ones given the stage of the spread of this infection that we're at. And that's not me saying that from my own knowledge as a politician. That is what I have been advised by to make sure that we are dealing with those who are most seriously unwell. That is why patients in hospital will be tested. Key workers, and the announcement that the Health Secretary indicated will be coming soon, will have a significant impact on the key worker testing, and then surveillance to make sure that over the weeks to come, because this will be critical in our judgments about whether more measures are necessary, or indeed whether and when we can start to lift some of these measures, is what this infection is doing, how fast it's spreading, where it is in the country, and that is why surveillance testing is so important. All of that involves considerably increasing the capacity of our testing facilities, and that is the work that is underway in a variety of different strands right now, which Parliament will be kept updated on.
Patrick Harvey.
Thank you, Presiding Officer. Can I first of all echo the comments of others? All of our thoughts are with those who have been directly affected by the virus, having lost a loved one, or indeed being unwell at the moment, and we wish them a speedy recovery, and with the very many dedicated professionals who are helping people through this crisis in every way possible in our public services and elsewhere. None of us in Parliament expected to be here to deal with a situation like this or to to pass the kind of emergency powers that are being contemplated, and I'm sure no one in government wants to be in a position of issuing the kind of instructions to the public that were made last night. But this response is very clearly necessary, and so the government will have the support of the Scottish Green Party in ensuring that this advice is heard and is heeded, that we all save lives and stay at home. In order to do that, of course, we need to have a home. And I am sure that I'm not alone. I know that other colleagues have been hearing on a daily basis from people in the private rented sector who have been given notice to quit by landlords in these circumstances for a range of grounds not always connected with rent arrears, or being given demands for ongoing rent payments, sometimes from landlords who are enjoying a mortgage holiday. I know that there are good landlords out there who are being as responsible and as flexible as they can in supporting their tenants, but sadly that is not always the case. So surely we need to ensure that there is a more robust response protecting private rented tenants. Can I ask the First Minister how she responds to the proposals from NUS, which come in 5 parts? Clear public health advice for landlords and tenants. Every landlord offering a no-penalty release from tenancy contracts. Governments banning evictions for all tenants throughout the duration of this crisis. Ensuring that tenants who are financially impacted by the crisis have their rent subsidised, reduced or waived for the next 3 months with the option to renew. And finally, a universal restriction on rent increases for the next 12 months. Surely we need to take the opportunity of the emergency legislation which is being brought forward by the Scottish Government later this week to ensure that we give the maximum possible protection to ensure that no one loses their home as a result of this crisis in what are deeply dangerous circumstances.
First Minister.
Can I thank Patrick Harvey for those points and questions. On the issue of emergency powers, I'm very clear that these emergency powers are necessary, but they should only be used if and when we deem them necessary to use, and they should only exist for as long as they are needed. And I would go back to the point I made earlier on. At a time when we are taking emergency powers, when we are asking the public to do things that restricts the liberty of all of us, scrutiny is absolutely essential, and I think we should all reflect on that in terms of how we operate in the weeks to come. On the private rented sector, I'm very happy to look closely at the NUS plan. I'll ask Mike Russell, who is overseeing the emergency legislation, to look quickly at whether there is material from that or suggestions in that we can include in the legislation, or even whether there are aspects of that we could do without emergency legislation. Aileen Campbell will obviously be very involved in that as well. I was clear last week at First Minister's questions, and I'll be clear again today, nobody should be evicted from their home as a result of this crisis, and I will make that clear at every opportunity. We've already indicated a legislative change we will make to expand the 3-month period for which people can't be evicted in terms of rent arrears to 6 months, and we will continue to look at how we give people additional security over and above that. So I hope it's helpful that we will look urgently at the suggestions from the NUS and seek to incorporate them as far as possible, and look for other opportunities to send that very clear message to not just private sector landlords, but landlords across all tenures.
Thank you. Willie Rennie.
Presiding Officer, my sympathies too are with those who have lost families, friends and neighbours. I don't know anybody who's been afflicted by this disease yet. I think when we do, I think it will become much more real, and I think people might take it a little bit more seriously in some quarters, and that's why it's really important that people do heed the advice of the First Minister to stay at home, to protect the NHS and to save lives. Because when it comes, it's going to hit hard. I have to commend the government and all the civil service. We're effectively creating a new government system within the space of 2 or 3 weeks. So as the First Minister said before, we are going to make mistakes, and today is about helping the government to try and mend some of those mistakes. Firstly, on childminders, there seems to be an issue about who childminders can accept, whether it's just key workers and vulnerable children, or is it a broader group. And I've been speaking to some of your colleagues about that, but it would be helpful to have some clarity on whether childminders can accept beyond key workers and vulnerable children. As I was driving into work today down the M90 motorway, there was a whole sweep of vans going up the M90 to building sites, packed full sometimes with workers, obviously not complying with the social distancing guidance. And I would hope we could particularly send a special message to workers that they do need to comply with this as well if we're going to halt the spread of this condition. They may be worried because they are self-employed that they need to go to work to earn an income. And that's why the UK Government does need to come forward with a self-employment package to take the pressure off that sector so that they can have something to live on. I appreciate the clarity on factories and workplaces, the difference between essential and non-essential. I've already had some businesses while I'm in the chamber contacting me about this. Still a little bit unclear about what actually is essential to make society work. So perhaps the First Minister could say a little bit more about what we mean on that front. And then PPE supply, I'm continuing to get lots of concerns, not just from NHS workers, but social care and nursing homes about the lack of PPE equipment. And I'd quite like to understand where the actual problem is. Is it on the distribution mechanism or is it on sourcing them in the first place? There's a lot of questions there, but I hope the First Minister can address a few of them.
First Minister.
Ready for that range of questions. I'll try and give an overview just now, but we'll come back on any points of detail that are necessary. I think he's right about people taking this seriously. And my impression, and it is impressionistic, is that people are taking this seriously in the main. But I guess in a situation like this, there is a sense of it feeling really surreal. And for the majority of us, we haven't come into contact with somebody who has the virus. So that will change, but I think my message would be, if we want to continue to reduce and minimise the number of people we know who have this virus, then do the right things now, and that is the best way of doing that. We also know that while the sort of estimates globally, and certainly based on the data here, is that the mortality rate from this is perhaps around 1%. That increases steeply as people's age increases. So it's much, much higher than that if you're in the over 70 or over 80 group, which for all of us, even if, and I think this is a mistake for young people, not that I'm calling myself a young person, but mistake for young people to think that they are not affected, that they can't get it or that they will only get mild symptoms. There's no guarantee of that. But even if that was true, if you don't follow this advice, you're taking the risk of infecting an older, loved relative. And they are potentially at significant risk. So we've all got to think about our responsibilities here. In terms of the comments about, we have and are kind of reconfiguring an entire government right now, and everything that sits behind the government, I want to put on record my huge thanks to the civil service. I've already said my most important thanks to the NHS, and will continue to do that. But the civil service have been working at pace and are doing a very good job with that. And the burdens and the challenges that they will face in the weeks to come are considerable too. And the Chief Medical Officer, the Deputy Chief Medical Officer, the ubiquitous Jason Leach, our National Clinical Director, all of these people are doing an incredibly good job, and I want to thank them for it. On the issue of childminders, we've not been overly prescriptive in terms of childminders. I will take away from this whether there is just a bit of guidance that we need to give to childminders to give them the parameters in which they should be operating. On construction, what you've set out here today in terms of what you witnessed on your way here this morning is why I think it's right to take a precautionary approach right now. And so my advice is that construction sites, apart from on essential sites like hospitals, should not be operating. Now, if we can put in place guidance and rules that would satisfy us that safe working on a construction site is possible, then we may change that in the future. And that is a general principle. We don't want to stop things happening if it's not unsafe for them to happen. But at the moment, it's really important that we take that precautionary approach, because this is about protecting health. On PPE, the supplies are getting through. I still want to say that if people feel they're not getting the supplies they need, they should let us know that. There is a global pressure on these supplies right now. We're looking, Ivan McKee's leading work for us, looking at whether we can repurpose some manufacturing to improve and increase the supplies of these things, but there are supplies in the country. We are working hard to get them where they are needed to be, but MSP should continue to tell us if they are feeling or hearing problems with that. And lastly, on the self-employment point, I have been inundated, as I'm sure we all have, with really worried emails from people who are self-employed or freelance workers. I believe that the UK government is taking this seriously. I believe they are working on something, and I hope that comes soon. But I want to reiterate how important I think it is that we see something similar to what's been done in terms of wage subsidy for those who are self-employed, because without that, I think these people will be in significant difficulty. So I may have missed one or two points of detail. If I have, I'll review the record and come back to Willie Rennie at a later point.
Thank you very much. I would just inform the Chamber that more than 30 members wish to ask questions or raise issues this afternoon. We'll try and get through as many as possible. I would also urge members, as we did last week, when they ask their question, if they could indicate which Cabinet Secretary they would like to hear from, that would probably be very helpful. George Adam, to be followed by Liam Kerr. George Adam.
Presiding Officer. Last weekend I was approached by many self-employed people in Paisley, particularly those that work in the leisure and entertainment industry, and how this will affect them financially. Can the First Minister provide an update? I know we're in talks with the UK Government on this issue, on the engagement with the UK Government, the Scottish Government has had, and on any financial protection for those self-employed and freelance workers in leisure and entertainment.
First Minister.
I'll maybe hand over to Kate Forbes in a second. We have been pressing the UK Government. As I said earlier, I am very optimistic we will see a solution to this, and I hope it comes soon. But Kate Forbes can update on the correspondence and other conversations.
Kate Forbes.
Thanks, Presiding Officer. George Adam is quite right. There are about 330,000 self-employed workers in Scotland, and they're absolutely critical to the economy. Both myself and Fiona Hislop have had a number of calls with our respective counterparts at the UK Government, and I believe that the UK Government understands the issue and is looking at delivery mechanisms. But our point, most recently made in a letter on Sunday, which we both signed, was that whilst things like the minimum income floor being removed, it does not go far enough in terms of support for the self-employed. And action that's been taken in other countries suggests that there are credible mechanisms to support the self-employed. And for example, Norway, Denmark, wage support schemes have been extended, and we believe that should be the case here in the UK as well.
Liam Kerr, followed by Monica Lennon.
Thank you, President Officer. My question is for the Cabinet Secretary for Justice. Many Scots will be wondering today to what extent the police will enforce this effective lockdown. So, keeping things to a very practical level and to emphasise the importance of compliance, is the Cabinet Secretary first of all able to help people understand what they might expect to be asked by the police if challenged, and can he outline what powers Police Scotland have already before the emergency legislation is passed to ensure these essential restrictions are obeyed?
Cabinet Secretary Humza Yousaf.
Can I thank Liam Kerr for the question? Can I just reiterate the approach as outlined by the Chief Constable over the last few days? And that's been first and foremost to thank the majority of the Scottish public who have complied with the guidance that has been forthcoming from both the UK and the Scottish Government. And of course, the Chief Constable is at pains, I heard him this morning on the radio also, to say that the vast majority of people are, of course, complying. But also the Chief Constable has made the point in his operational responsibility and independence and keeping in his responsibility that he has to keep the public safe, then where he has enforcement powers, he will certainly use them. We saw that when closure notices were forthcoming in relation to those premises, those pubs that did not comply with the order to close. In relation to existing powers, there are existing public health measures that apply in Scotland, which are similar across the UK. They already permit, for example, court orders to quarantine persons who are suffering from an infectious disease. However, of course, as the member will be aware, with the emergency legislation that is going through respective parliamentary processes, that will give more stringent powers, but also powers that can be used, frankly, on the spot, as opposed to necessarily having to go through court orders. But of course, we are appealing to people to heed the advice for themselves, for their safety, but also for the safety of the public at large. So the police will continue to take that approach with the public. But of course, where necessary, the Chief Constable has already demonstrated that where he has to use enforcement powers, he will do so.
Monica Lennon, to be followed by Joe McAlpine.
Thank you. A question for the Health Secretary and then a brief one for the Community Secretary. In relation to the letters going out to high-risk individuals, can the Health Secretary say when people can expect to get those letters? And, you know, we heard today that there's almost 600 confirmed cases in Scotland. What is the community surveillance telling us in terms of what the likely number of cases is likely to be? And this won't be a unique example, but last week the very welcome announcement with the Wellbeing Fund of the £50 million. Charities and others are waiting to hear when they can access that money. Bernardo Scotland have told me that they've identified just over 2,000 children who could be doing with that money right now. They can get that out to those families. Can we get an update on how quickly charities like Bernardo Scotland and others can get access to that critical fund?
Could I ask members just to restrict themselves to one question from now on? Jean Freeman.
Thank you. I'm grateful to Ms Lennon. On the two questions, in terms of the information, the direct information going out to that group of 200,000 patients at most at risk, that began today. It goes out by various different means. Some of the groups are much easier to contact directly. Through others, the contact is through their GP. I'm happy to write to Ms Lennon and just explain the detail of that, but we anticipate that all of that work will be completed within a week. So by all those routes, that's what we will do. In terms of community surveillance, it's too early at this point to be able to answer that question with any sense of definition or robustness. But again, as we get the additional information, as that surveillance data comes in, as the First Minister described, we will make sure that we keep Parliament up to date on what that is telling us.
And Aileen Campbell.
Thank you, and I'm aware of the situation that Bernardo's have described to Monica Lennon. They're using funds of their own to support those families that they've identified at immediate risk. We have their submission in place. There will continue to be discussion between my officials to kind of go through some of that, but we're wanting to work at pace to make sure that we can get the support out to the communities that we know require it, and the community groups that are also emerging to support their own communities and to support their own resilience. We're working with third sector local authority partners to ensure that we get the right balance and blend of ensuring that local level, very, very local support gets through, alongside the bigger, broader, more thematic work that some organisations like Bernardo's can provide. But we'd also make sure that if anyone's facing financial hardship, that they should make sure that they you look to the welfare system, that they have got the right support and they're getting the right entitlements from that, and make sure that they've got their claims in to ensure that they can overcome any financial challenges that they've been plunged into as a result of the pandemic. But certainly we're aware of Bernardo's ask. We're working on it, and that has been just in a case of, that's just been a space of a couple of days.
Joan McAlpine, followed by Miles Briggs.
Thank you. My question is for the First Minister. I've been contacted by a number of self-isolating elderly and vulnerable people who cannot get food delivered by the supermarkets, who are in many cases booked till mid-April, and these people feel that the hourly shopping hours set aside by the supermarkets isn't safe, although it's well-intentioned, but it contradicts the self-isolation advice. Is there any plan for the government to work with the supermarkets to perhaps prioritise deliveries to vulnerable people? And also, can I ask you to clarify that in off-grid areas, that suppliers of wood fuel and biomass are essential services that people can continue to use to heat their homes? Thank you.
First Minister.
Well, in terms of elderly people, I mean, obviously the advice we've given now is for everybody to stay at home, although they can go out for basic necessities, preferably no more than once a day, and that would be the case for an elderly person if they're able, unless of course they have symptoms or they're in one of the other groups that require more of an isolation approach. So I just want to make that point clearly. We have been in dialogue with the supermarkets. Fergus Ewing has had those conversations. I know the supermarkets are working hard in terms of trying to make sure they have supplies flowing, and also that those who have most priority get the earliest and most prioritised access to them, and they continue to work hard to make sure that that is the case. I would take the opportunity to give another general message to the public about not panic buying and stockpiling, because it is that is causing supply issues, not any underlying shortage. There is no shortage of food in the country. So if people act responsibly, buy responsibly, shop responsibly, then these issues should not arise. Obviously, our resilience partnerships are working locally, and part of the focus there with local authorities is to make sure we are doing everything we can to identify any particularly vulnerable people who are not able, through their own family networks or through their own ability to get the supplies they need, and that work is really important. On the biomass point, I'm happy to take that away and give an answer based on some proper advice. I would just repeat the general advice to businesses. We've given information on those who should definitely be closed, those that should definitely be open because of the essential nature of the work that they're doing, and some key checkpoints, if you like, for those in between about whether they can operate safely or not. There will always be a number of specific questions. I'm certainly getting lots of them today. We will not be able to answer every single question with specific bespoke advice, but we will do our best to give every company and every sector the detail that they need and the guidance that they need to make the right decisions.
Miles Briggs, to be followed by David Stewart.
Thank you, Presiding Officer. This is a question for the Health Secretary. For the 200,000 of our fellow Scots who will be receiving letters this week, it will be deeply concerning. But for those who are currently going through cancer treatment or about to commence their cancer treatment, it's terrifying. It's a terrifying time for them. I know from the emails I've already received. So can I ask the Cabinet Secretary, when will the Government update Parliament with regards to the Cancer Action Plan she announced last week, so we can make sure we continue to deliver cancer treatments through this public health emergency?
Jean Freeman.
So I'm happy to make every effort to update Parliament next week on the Cancer Action Plan. I think what is really important is that we recognise that our National Health Service is not only stepping up to address the particular challenge of this virus, but is also continuing to treat patients in terms of emergency, urgent care, and that includes cancer and maternity care. So, and I also appreciate that this is a worrying time for everyone, but particularly for that group of people who we are strongly urging that they isolate in their own homes for 3 months. That's really very stringent, and that is because they are most at risk of becoming very seriously ill indeed if they contract that virus. So there is much for them to worry about, but many of them already know all the steps that they need to take in normal course to protect themselves because of the condition that they suffer from. What we need to make sure of, and what I tried to outline, and again, very happy in the coming days to set out more detail for members through a letter or whatever means we might find, what they really need is to know that the additional support that they need, where that cannot be provided by family or friends, and again there that needs to be very carefully done about how that contact is made. That additional support is support that with our local authorities, through the resilience partnerships and with an army of volunteers, in fairness, we will make sure is provided as much as we possibly can.
David Stewart, to be followed by Sandra White.
Thank you, Presiding Officer. My question is for the Cabinet Secretary for Health. In previous statements, the First Minister rightly referred to the crucial role of ventilators in ICUs and their critical shortage worldwide. Does the Cabinet Secretary welcome the breaking news of the development of rapidly manufactured ventilation systems, which are lightweight, robust, and require no more than 30 minutes training for our hard-working medical staff to use?
First Minister.
So Mr Stewart is absolutely right, and he and I have talked more than once about the situation in ventilators, indeed only this morning at committee. So any innovation that comes forward that is robust, that we know is evidenced and exists, is something to be welcomed. And that indeed is why my colleague Mr McKee has his very focused group looking at the whole manufacturing those innovations, testing that out with a degree of expertise and skill in order to advise me as the Health Secretary whether this is a genuine opportunity for us to very actively pursue. So that cross-government look at how we acquire the equipment that we need to address this particular challenge is a really important one, and one that I very much welcome.
Sandra White to be followed by Jamie Green.
Thank you very much, Presiding Officer. And I thank the First Minister for her statement. This question is for the Education Cabinet Secretary. Cabinet Secretary, I've received numerous correspondence from students who have been told, foreign students who have been told they have to go home and they're having to pay their rent up until August. I also have other students who are were working and are not working now and can't afford to pay their rent and being told they have to pay for their student accommodation. Can the Cabinet Secretary tell me, perhaps SAS or someone else can give them some form of financial help in this particular situation?
John Swinney.
Presiding Officer, these issues are under very active discussion between the Higher Education and Further Education Minister Richard Lockhead and a number of providers. A lot of the accommodation to which Sandra White refers is in the private sector, and obviously we are trying to work to protect the interests of students who are facing increased costs as a consequence of the situation that they face. So the furthest I can go today is to say that we are actively pursuing the issue. We recognise the seriousness of it as it affects individual students, and we will of course update members, and particularly Sandra White, on the progress that's made in those discussions.
Thank you. Jamie Green to be followed by Neil Findlay.
Thank you. Many parents are very grateful of the work of local authorities who in just a few short days set up provisions for schooling and childcare to those who need it most, but many others are doing their best to teach and care at home in very difficult circumstances. So may I ask the Cabinet Secretary for Education what role Education Scotland is playing to assist COSLA and local authorities support and equip parents with the resources they might need to best teach at home, but more importantly, when will the SQA be forthcoming with detailed advice around the completion and submission of coursework and the new process for awarding qualifications?
John Swinney.
On the second point that Mr Green raises about the SQA, I would ask members to be patient and to understand that we are having to move significantly in a very short space in time to a new way of working. I expect the SQA to make a statement this afternoon in relation to coursework, which I hope will clarify the position, and obviously the material that I set out to Parliament last week in relation to the certification approach is being actively developed and is I appreciate the anxiety and the nervousness, but we have to take time to get that correct because young people's qualifications will rest upon it. In relation to the first point on the availability of online learning, there is a huge amount of really outstanding work being done by teachers around the country. I know that the Swinney household yesterday morning was involved in an online PE lesson in which all members of the household took part, except the oldest member of the household. And there's a lot of really good work that's been undertaken. Education Scotland are actively working with individual local authorities and schools to support that work. Essentially, schools have done a really good job in trying to make sure they've got digital connectivity with young people and students, and Education Scotland are supporting the development of any appropriate resources that are required as part of that process.
Neil Findlay to be followed by Emma Harper.
I don't envy the government's position, and I accept the First Minister said the government will make mistakes, and we all accept that. But does she recognise that some Scottish professors of global health are saying we're making a mistake just now by not following the WHO advice to trace every case, to test every case, and to isolate every case?
First Minister.
So can I try and address this point again in detail, because this is a point that I have asked a lot of questions of my advisors of. The WHO advice, and I certainly am not qualified to second guess it, but it is very much for, as I understand it, a contained phase of an infection outbreak. We are in the delay phase. Now, I want to be absolutely blunt about this, and the UK, Scotland within that, probably has, certainly based on what I have been told, per head of population proportionately, the greatest testing capacity of perhaps any country in the world. We could not test every single person with symptoms right now. It would overwhelm not just our testing capacity, but the resources of our NHS overall. We are ramping up testing capacity significantly within our own labs. That the Health Secretary and I have already alluded to today. There will be another significant announcement UK-wide to add capacity substantially to that. But we will still have to prioritise where that testing capacity has greatest effect. And that's the 3 areas that I have already set out. Now, in terms of Neil Finlay's question, which I understand about testing, tracing and isolating. Of course, I've set out the position on testing, but we are asking anybody with symptoms to isolate. That is the whole point of the advice that is being given. If you have any symptoms indicative of coronavirus, and for the avoidance of doubt, that is a new persistent cough or a fever, you should be staying at home. You should be staying at home for 7 days. If you're in the household of somebody with those symptoms, you should all be staying at home for 14 days. So, you know, if we had the capacity to test everybody with symptoms right now and we got positive cases, the advice we'd be given to those positive cases is exactly the same as the advice that we are given to those with symptoms. So we are in the delay phase of this, and that's why the approach to testing and all of the advice that we are giving is, in the opinion of the experts that advise me and the Health Secretary and the Government, the appropriate action to be taking. And I repeat again, that is testing for those most seriously ill, testing for key workers and testing to allow us to monitor the spread of the infection and how it's behaving in certain other ways, which is similar, but it will be on a bigger scale to what we do every year with flu.
Emma Harper, to be followed by Maurice Golden.
The First Minister has already described that she is all too aware of the incredible work being carried out across our health service during what is a difficult time for our NHS staff, many of whom are my former colleagues. Can she provide, or the Health Secretary provide, assurances that mental health support will be available to NHS staff should they need that support?
Jean Freeman.
Thank you. I'm grateful to Ms Harper for that. It is very important, and the point I want to make about that is that as the First Minister and I have said, and the Chief Medical Officer has said, what we are attempting to do with all of the measures now in place is reduce the peak level of cases so that our health service can cope, and so we reduce the number of avoidable deaths. What that does mean, though, is that our health service will be working under significant pressure for longer. And so the health and well-being of our NHS and social care staff is really important. And that is why Ms Hockey, as the Minister for Mental Health, is leading a piece of national work with individual boards and extending through to local authorities and social care providers to look at what more, in addition to what they are doing, what more we can do to assist them to ensure that support is available to staff in situations of high stress and anxiety. Practical support is available to them in terms of rest areas and just the ability to make a cup of tea and take 5 minutes or 10 minutes out. And the other support is available to them online or directly, depending on what makes most sense and is most used to them. And as that work solidifies or consolidates across the country, then again we will be very happy to make sure members understand what it is we're doing and hear from them if they think there is more that we can do. But please be assured we take that very, very seriously indeed.
Maurice Golden, to be followed by Polly McNeill.
Thank you, Presiding Officer. My question's on roadside recovery, and happy for the most relevant Cabinet Secretary to respond. Will further guidance and support be issued for the roadside recovery industry to allow them to continue essential emergency response during this period?
Cabinet Secretary Michael Matheson.
Presiding Officer, I'm aware that the sector have raised a number of concerns going forward that may create some challenges for the industry in being able to provide the level of resilience that's necessary in roadside recovery, particularly in helping to support our logistics and haulage industry, where they play a critical role in helping to maintain essential links. We're in discussions with the Department for Transport within the UK Government to look at what further measures could be put in place to help to support the industry during what is a challenging time. Of course, it is absolutely essential that we maintain our transport and logistics network at this crucial time, and the essential work that the recovery services play within that is fully recognised by the Scottish Government, and also from a discussion we've had with the UK Government by the UK Government. But I can assure the member that it's an issue which we are very much aware of and will continue to work with the UK Government on in seeking to try and resolve some of the concerns which the sector have.
Polly McNeill, to be followed by Bob Doris.
My question is to the Cabinet Secretary responsible for housing. Thanks to the First Minister for her statement that there should be no evictions in answer to Patrick Harvey. But will the Government actually legislate for no evictions? Because the one they previously announced was extremely narrow. There are 17 grounds for eviction. We need to remove them all. So will they legislate as soon as possible for that? Rough sleepers are amongst the most vulnerable people and unable to self-isolate. Can the Government ensure that they are not criminalised in any way? And can she give any details of any package that they are intending to announce to help rough sleeping?
Aileen Campbell.
And again, we've been very clear that nobody, as a result of the ability to cope with this pandemic, should lose their houses. There should be no eviction as a result of COVID. And our emergency legislation will have provision to ensure there can be no evictions from the private rented sector or the social rented sector for 6 months. And aside from the legislation, I have also had assurances from the SFHA that they will not, and their members will not evict anyone at all during this time. But of course, we're going to take forward the legislative packages. Now, there's old version. Tennessee, the assured and short assured, has 17 clauses. The new one has 18. We're looking to use and extend notice for the majority of those grounds. And of course, we'll continue to explore with you any issues you want to raise with that. But I hope that gives you some certainty that it's not just on the arrears, but it's looking at the number of clauses for notice of eviction and to extend the majority of them for the 6 months to essentially give effect to the fact that we do not want to see anyone lose their house over the head of this pandemic that we're trying to cope with.
Bob Doris, to be followed by Murdo Fraser.
Thank you, President Officer. It's for the Cabinet Secretary for Communities. I welcome the announcement about the potential grocery contract to get food to the most vulnerable 200,000 that the First Minister referred to. But can I ask what clear and practical advice for those who are addressing food need in their communities now or imminently will be in relation to those who are attending food banks or food hubs to make a donation, because there are safety issues potentially there as well, or to receive support, for volunteers heading to food hubs to prepare and supply that food, including sometimes coordinating home delivery. It's important that this can function, but people are as safe as possible, exercise sensible social distancing, and we're not inadvertently spreading the coronavirus as a result of that on-the-ground strategy, which is absolutely vital.
Aileen Campbell.
Yeah, thank you. And there's a range of good points that Bob Doris makes. I think, again, the First Minister made mention of the readyscotland.org website. I would certainly ensure that Bob Doris is directing any queries to that website. That will give good guidance about how to keep yourself safe and to keep everyone who wants to volunteer and play their part safe as well. We are looking to and have worked with and are continuing to work with Fair Share Scotland to ensure that that is one way to distribute food and support to food banks, but we also know that there are food banks that are facing particular pressure. So again, with the £70 million that we announced last week, we want to ensure that there can continue to be an adequate food supply for people who are requiring it or facing that financial hardship. And again, we are working with Social Bite as well for those that are homeless, and they're actively at this point in time distributing food out to those that are particularly vulnerable as well. So in amongst all that, there is also scope for any local initiatives to come forward, ask for support if they require it, so that they can help with the resilience of their own community. But I think the point is well made that we need to make sure that the balance is there between people staying at home alongside the advice and support that they require to ensure that that volunteering effort can continue.
Murdo Fraser, to be followed by Jackie Bailey.
Thank you, Presiding Officer. I have another issue around food supply and food security, which I think should go to the Cabinet Secretary for the Rural Economy, but I don't think he's here, so I'll let the First Minister decide who's going to answer it. There are soft fruit growers in my region in Perthshire and Fife who at the moment are very concerned about the availability of labour to harvest crops in the summer season due to the fact that the normal migrant workers they depend upon may not be able to travel to the United Kingdom. What advice would the First Minister give to those looking to plant crops at the present time, and what assistance can the Scottish Government give to this sector about accessing the labour that they need?
Minister.
Rather than give advice right now that may not be the right or the best advice, can I undertake to take that away and come back to Murdo Fraser very quickly with some advice, and we will then disseminate that to the wider sector, because it is an important point that we want people to be doing the right things now in order that they are not compounding issues for themselves in the future.
Thank you. Jackie Bailey, to be followed by Kenneth Gibson.
Could I ask the Deputy First Minister about the designation of key workers? There are police officers who are considered to be Category 2 workers being denied childcare, severely compromising their ability to do their job. Pharmacy and food retail workers who've been working really hard are defined by the Scottish Government as being part of the critical national infrastructure. Can he confirm that they too are in Category 2 of the key worker definition? Because in some areas they're being denied support. So will he therefore ensure that the guidance to local authorities is clarified to avoid a myriad of different approaches being taken, so that our Category 2 key workers receive the childcare support they need?
John Swinney.
Well, there are a few, I understand the seriousness of the issues that Jackie Bailey raises, but there is also an important point that has to be borne in mind, and that is that we have to minimise the number of children that are brought into learning and childcare settings, because if we don't, we will defeat the public health advice that is driving this exercise. So I'm sorry if that sounds hard, but we have to be conscious of the need to limit the number of children coming into settings, which is why I appeal to employers and to families to follow the tiered guidance that we've put in place, which is about trying to find alternative solutions for childcare before trying to secure childcare settings through local authority provision. Now, we have deliberately left flexibility in the hands of our local authorities. Whilst giving the clarity which Jackie Bailey sets out in the guidance, I confirm the points that she makes about the composition of Category 2. We have deliberately left flexibility with local authorities to take into account the circumstances that are presented to them, because in some parts of the country there will be some sectors that are more prevalent than in other parts of the country. If we specify a uniform national approach, then we will create just a different set of anomalies to the ones that Jackie Bailey has raised with me today. And as a consequence, we will not enable the key workers that we need to be able to contribute to the national effort and who need childcare support to be able to get that. And that's the objective that we jointly share with our local authority partners.
Kenneth Gibson, to be followed by Alison Johnson.
Thank you, Presiding Officer. And my question is for the Finance Secretary. Last week, the Bank of England cut base rates to a record low of 0.1%, but few banks have passed this on to borrowers, and many have actually increased loan and overdraft charges. For example, HSBC has increased overdraft charges on unauthorised overdrafts from 9.9% to 39.9%. Does the Scottish Government agree with former Pensions Minister Baroness Altman that credit card charges should be cut to 0.5% for the next 12 months? And will the Cabinet Secretary raise the issue of loans, overdrafts and credit cards with the Financial Conduct Authority?
Kate Forbes.
Well, I am in regular, as is Fiona Hislop, contact with the banks and the wider financial industry. And if there are particular areas of concern, then I'd be more than delighted to raise that directly with the banking industry. In terms of the support that's available, whether it's banking support or government support or the welfare system, all of this is designed to allow people to continue to pay bills, to feed themselves and to go about their daily business. And any form of government support is designed to be supportive to people's cash flow issues right now in light of redundancies and other things. So the expectation on banks is to look favourably at any requests whatsoever from individuals about payment deferrals and about reducing their costs, not increasing them. So where there are specific issues, please raise them with us. These should also be passed on so that we can raise them with the banks directly.
Thank you. Alison Johnson, to be followed by Bruce Crawford.
Thank you. I welcome the Health Secretary's pledge to expand testing for NHS staff, but current guidance tells NHS staff with symptoms you will not be tested. Will this message, which has been sent out on a daily basis and again this afternoon, be updated to ensure that the concerns of frontline NHS staff and indeed the sustainability, to ensure that that is addressed as a matter of urgency?
Jean Freeman.
Yes, it will. I mean, there was no point in telling people they would be tested until we had the processes and the systems in place to do that. Now that we have, to begin that work in the way that I described, then we will update that guidance. But it needs to be very clear about how we are testing to the capacity. As the capacity increases, we will be able to increase that.
Bruce Crawford, to be followed by Alex Cole-Hamilton.
Thank you, President Officer. I think this question is for the Cabinet Secretary for Transport. I wonder if he can help give advice to a frontline ambulance driver. His car's MOT runs out at the end of the month. His garage is now closed. He cannot find another MOT appointment. He lives 30 miles away from his hospital where he starts off his work from. I'm not expecting necessarily an answer today, Cabinet Secretary, but he'll not be the only emergency worker in such circumstances. Is there a case for the DVLA waiving MOTs in these circumstances, or is there another way forward for such important workers?
Michael Matheson.
Presiding Officer, Bruce Crawford's raised a very important issue, and that is the growing challenge we have around individual car owners being able to get access to an MOT check being carried out on their vehicle, which naturally can have an impact on them being able to tax their vehicle and also invalidate their insurance if they no longer have a valid MOT. The member may be aware that in Northern Ireland, where they have pillars around this, that the Northern Irish Assembly have given an exemption certificate for some 3 months for heavy goods vehicles, for buses and also for trailers, but not for cars as yet. And the reason for that is because we're in discussions with the Department of Transport to see if there's a means by which we can actually provide a UK-wide exemption for a limited period of time for those who may own a car of 4 years or more. I recognise a very specific challenge that this is creating. We've raised the matter with the Department of Transport, and the obvious solution would be to give people an exemption certificate for some 3 months, which would allow their insurance to be renewed if necessary, or to remain valid, and also to renew their tax disc if necessary also. But I do recognise a specific issue and will continue to press the Department of Transport on the matter to get a resolution to it quickly.
Thank you. Alex Cole-Hamilton, to be followed by Willie Coffey.
Thank you very much, Presiding Officer. The First Minister will recognise the tremendous upsurge in community spirit growing in our communities, in the mutual aid groups and neighbours doing favours for neighbours, in 1,000 seemingly tiny acts of community service. An example of this goodwill can be seen in the hot meals being safely prepared right now and delivered free of charge to vulnerable people in self-isolation. 2 organisations operating in my constituency, the Scran Academy and the Torfin Pub, will deliver over 1,000 such meals this week alone. They are concerned that when the police begin to enforce lockdown, their drivers and their cooks may be prevented from delivering this vital work. Can she reassure them that this work will be allowed to continue during lockdown? And can she explain to the Chamber the system that will operate to allow key workers to move freely during that lockdown period?
First Minister.
Can I firstly take the opportunity to thank the countless numbers of people across the country who are stepping up to volunteer and make a contribution. I know I've seen lots of examples of that. I've had many emails from people offering their help, and I think I'm not at the stage really where it's possible to put a silver lining on this horrible cloud, but I do think there are elements of in which we are seeing the best of people and the best of communities, and that is certainly something to hold on to and be inspired by. In terms of the specific point, we're very clear we want that voluntary effort to continue. We want people who are caring for others to be able to continue. I have confidence that the police will well, firstly, we'll not have to do enforcement because the vast majority of people will comply with the rules that we are asking them to comply with. But we have good community-based policing by consent in this country anyway. I spoke to the Chief Constable last night after Cobra took these decisions, and he is confident that he will be able, and his officers will be able to police this in an appropriate way. And any enforcement will be for the minority of cases, and I expect it to be a tiny minority of cases that are flagrantly breaching the rules with no consideration for others. And I know the Chief Constable and the police are very mindful of the need to allow that voluntary caring effort to continue, because we all need it to.
Willie Coffey, to be followed by Mark MacDonald.
Thank you. First Minister, I'm still getting messages right now from worried constituents who are being dragged into work by their employers, who are not in the key categories that you mentioned earlier. What enforcement powers will we use to force these employers to close, to protect their staff and to protect the wider public?
First Minister.
I want all employers to behave responsibly, and I think the vast majority of employers are behaving responsibly. If somebody is running a business of the type that has already been told to close, so pubs, restaurants, now non-essential retail, then just as the police did with closure notices over the weekend, and when the new emergency powers come into force, that will be enforced if necessary. I fervently hope it will not be necessary. There's, at the other end of the spectrum, categories of business that we know have to continue because they're vital to the effort to fight coronavirus, and they are vital to keep the country, the well-being of the country going. So food supplies, energy to keep the lights on. There is a difficult group of businesses in between where we cannot give a categoric answer for every single one on a bespoke basis. That's why I am trying very hard, and will continue to do so, to set out clear guiding principles. And the first principle is employers should take responsible decisions based on a precautionary principle. If you're in any doubt that what you're doing is in any way putting the health of your workforce at risk, you should not do it, and you should not be open. And I think that is the first principle. Secondly, you should be allowing your staff to work at home whenever possible. Now, there are some businesses, the nature of which that is not possible. So then the questions that must be asked for people, if they consider themselves to be doing essential work, is, are you able to have safe social distancing and obviously comply with all the normal health and safety requirements? Now, for a business, if the answer to any of these questions is no, then you shouldn't be continuing as normal, and you shouldn't be continuing to expect your workers to come to work. So we will do our best, in addition to that guidance, to try to offer specific guidance to sectors or companies as these issues arise. But the overall thing, just as we are saying to the public, do the right thing for the right reasons, I have to say to businesses, please do the right things for the right reasons. This is a horrendously difficult situation for everybody. Nobody doubts that. And I don't doubt for a minute the really difficult decisions businesses are having to take. But these measures are in place. And I come back to this central point. These measures are in place to save lives. And I would ask everybody, whenever we're feeling frustrated about all of the inconveniences and disruption to our daily lives just now, individual and business lives, just remember that. What we do right now will ultimately determine how many people die from this virus. And the more of us, businesses and individuals, who do the right thing, the fewer people will die. And I think that should be the motivation for each and every one of us.
I'm conscious we're not going to be able to get through every member. However, I'm going to extend the session till 10 past, so another 7 minutes, with members' understanding. Mark MacDonald to be followed by Fulton McGregor. Mark MacDonald.
Thank you, Presiding Officer. My question is for the Cabinet Secretary for Health. There are individuals with addiction issues who, up until this moment, have been receiving treatment through the NHS. There are individuals with addiction issues who have been receiving support from groups such as Narcotics Anonymous, Alcoholics Anonymous and Gamblers Anonymous. And there are individuals with addiction issues who may not yet have sought treatment but face the possibility of 3 weeks of inability to feed those addictions, while at the same time being in the household with family members who may not be aware that they are living with an addict. These are 3 very different categories who require 3 very different pieces of advice, support and assurance. Can the Cabinet Secretary advise if this is under active consideration, and what steps the Scottish Government will take to support both those individuals and also family members who either are supporting them through their addiction or may not yet be aware that they have an addict in their household?
Jean Freeman.
I'm grateful to Mr MacDonald. This is a very important issue, and Mr Fitzpatrick and I have been in discussions about that. It is under active consideration what we might do. Some of the organisations that you've mentioned, by their very nature and by the ethos by which they work, will want to be very self-contained in how they continue their work whilst maintaining social distancing and so on, and I know are actively looking at means by which they do that. We will make sure that they have our offer of support if they wish it, and if they want to take it. On the last group, if you like, that you mentioned, that is a particularly hard area to work through how we might offer that support. Not about the individual who has that addiction and those difficulties, isolating or staying at home, but where their family does not know about that and what support we might then offer. So we are giving that active consideration. I'd welcome any specific propositions that members have that we should, they think we should be considering in that particular area, and I'm very happy as we make progress on this to make sure that members are updated on the work.
Fulton McGregor, to be followed by Brian Whittle.
Thank you, President Officer. My question is also for the Cabinet Secretary for Health. I'm wondering, it's on tests, and I wonder if there's an update on the antibody tests that were previously talked about, when they may be available. And does she feel that this could be a crucial test in identifying who has had the virus, and particularly important for those in the front line?
Jean Freeman.
So, Mr McGregor raises a very important question, and this is and will be, when it is available, a very important test for us. Our current understanding is that we are hopeful it will be available in the near future, and I recognise that is completely without any specificity, but as the First Minister said, better to give members accurate answers that we can be confident of. So at this point, all I can say is we are hopeful it will be available in the near future.
Brian Whittle, to be followed by Anas Sarwar.
Thank you, Presiding Officer. A question for the Cabinet Secretary for Communities. She is aware, of course, that the third sector are under a lot of pressure just now and are working with some of the most vulnerable in society. People like with poor mental health or addiction or homelessness or even Alzheimer's disease, where isolation has traditionally been the enemy, and of course now the advice is completely opposite to that. So can I ask her, can I ask the Cabinet Secretary what support and advice she can give to the third sector who are trying to work through this difficult time?
Aileen Campbell.
The third sector, who are absolutely fundamental and crucial to the response the country has for the pandemic, and my officials are actively working with some of the organisations that cover the issues that Brian Whittle raises about the funding that we announced last week around the third sector resilience, so that more general resilience fund that they will require to help them continue to function, alongside the support that they will be able to do to help the communities and to prioritise some of their existing work to cope with the demand that will be placed upon them. So officials are actively working with a number of different organisations, SCVO, the Cora Foundation, Hunter Foundation, a number of organisations like that, to ensure that we get the resources in the right places as quickly as we can to support the need that Brian Whittle rightly recognises.
Anas Sarwar.
Officer, can I thank the First Minister, all Ministers and officials for their positive engagement. Yesterday I heard the Cabinet Secretary say that the minor ailment service will be expanded. That will obviously put more pressure on pharmacies, so I wonder what acts are being taken to make sure there's positive equipment being supplied to pharmacies. There's also a number of opticians, dentists, dental nurses who have skills that can be used in the National Health Service. What has been done to draft them in to support existing NHS staff? And finally, a sensitive issue. A number of doctors, for a variety of reasons, have opted out of the Scottish Public Pensions Agency scheme, meaning that if they were sadly to contract the virus and to die of it, they currently, as it stands, would not get, or their families would not get, the death in service payment. What immediate actions have been taken to reassure those individuals that their families would receive such a payment? After all, they are the heroes at the front line in this crisis.
Jean Freeman.
Thank you very much. Grateful to Mr Sarwar. Can I start with your last question? That is actively being looked at the moment to see what we can do in those particular circumstances, fully taking on board the points that you make, and in discussions partly with the UK Government and also partly with our Scottish Public Pensions Authority in that regard. We have, as you say, we have 1,257 community pharmacies, 2,500 community pharmacists across Scotland, a huge resource and one that is very keen indeed to be actively involved in the extension of the minor ailment service. Their access to the emergency care record came as a direct result of meeting them last week. And I'm very pleased and grateful to our Chief Pharmaceutical Officer for ensuring that happened in the space of days. That is a huge resource to healthcare in the community. And we have also had discussions with them about the particular PPE requirements they have and the additional other requirements that they have too. And I'm very confident that that will make a significant difference. In terms of the other professionals that you described, you're absolutely right. Dentists in particular, but also those others, all have really significant skills. I'm really pleased to say that many of them have been in touch to say, how can we help? We are undertaking emergency treatment only at this point, and as a result of guidance from the Chief Dental Officer, what more can we do? And the Chief Dental Officer is actively looking at how we can harness that particular workforce. And in terms of optometry, then of course they will be able to provide significant support on emergency eye treatment. We have reached an agreement with them in terms of the sustainability of their funding in a situation where they won't be undertaking some of the work that they normally would do and are paid for. So we have reached an agreement with them to ensure that their businesses are sustainable through this period, and they will continue to undertake that emergency eye treatment. All of that is then fed in to those to NHS 24 and others, so that they can point people in the right direction for the care they need.
Thank you very much. I'm very conscious that a number of members have sat patiently through the session waiting to ask questions, and I'm afraid I can't take any more. We've got two substantial statements coming up from the Lord Advocate, the Cabinet Secretary for Justice, as well as emergency legislation and local government finance orders. So we have to move on to the next item of business. Thank you to members and ministers for your understanding.
The next item of business is a statement by the Lord Advocate and Humza Yousaf, Cabinet Secretary for Justice, on Justice COVID-19. The Lord Advocate and the Cabinet Secretary will take questions at the end of their statements, so there should be no interventions or interruptions. And I call on the Lord Advocate for up to 5 minutes, please.
Deputy Presiding Officer, in the last 10 days, all of us have had to respond to one overriding imperative: to follow the Government's public health advice, which, as the First Minister has just reminded us, is designed to save lives. That required an immediate response from the justice system. And last Tuesday, the Lord President announced that no new jury trials would commence until further notice. He was right to take that step, which was entirely consistent with the public health advice. Since Thursday, the Crown, in cooperation with the Court, has been taking steps to adjourn most summary trials, trials dealt with by a sheriff or JP without a jury, until June. The only business going through the criminal courts at this time will be essential custody business. Those steps will have a profound impact. They involve putting on hold almost all criminal trials. But they were and are necessary steps. They will help all of us, staff working in the justice system and citizens alike, to comply with the public health imperatives. And as we take these steps to address the urgent public health advice, I am committed to maintaining the rule of law and the fair administration of justice, to respecting the rights of the defence and fulfilling our ECHR obligations. My watchword in the steps which I am taking as head of the system of prosecution in response to the current situation is and will continue to be the safety of the public. Last week, the Chief Constable and I set out our shared commitment to keeping people safe from harm and to dealing effectively with those who do not comply with the law. The police will continue to respond to crime. They will continue to report cases to the Procurator Fiscal. Where individual or public safety justifies that course, accused persons will, in accordance with guidelines which I issued on Friday, continue to be taken into custody, and prosecutors will continue to take action in accordance with the Scottish Prosecution Code. Where there is sufficient evidence and the public interest requires a prosecution, prosecutions will be initiated. We will seek where we can to resolve cases and to progress them with the minimum need for appearance at court. Where a hearing requires to take place and the accused is in custody, the accused will, where possible, attend by video link. Where cases cannot be resolved, and the case is one of the very small number of summary cases where a trial can and should take place, we will keep the number of witnesses who are required to attend to the minimum necessary. Where a trial cannot take place, and I have to be frank that that will be the great majority of cases which cannot otherwise be resolved, we will have no option but to defer that trial until the public health guidance allows business to resume, even if that means that the accused has to remain in custody meantime if public safety demands it. And we will need, where necessary, to seek extensions of the statutory time limits which apply. Let me turn from the prosecution of crime to add that adjustments are also being made at this time to the system for the investigation of deaths, with a view to relieving pressures on the medical profession. And can I, at this time, thank all those involved in delivering justice across Scotland for their response over the past 10 days, and also in anticipation for their continued support during what will undoubtedly be a challenging period ahead. I would like to express my appreciation of the staff of the Crown Office and Procurator Fiscal Service, who have been working enormously hard to do what has been required of them. And I would also like to thank publicly the wider legal profession for its understanding and support in relation to necessary measures which will have a significant effect on many practitioners. The administration of justice is a collective endeavour in which all those involved have an essential part to play, in which mutual respect for our distinctive functions goes along with our shared responsibility to deliver justice to the community which we serve. Never more so than at this extraordinary time will we need that sense of collective endeavour in the service of justice, whilst doing what we all must do collectively to minimise the loss of life. Thank you very much.
I now call Humza Yousaf. Around 5 minutes, please, Cabinet Secretary.
Presiding Officer, the word unprecedented has been used many times over the last few weeks. However, frankly, it simply does not do justice to the times that we find ourselves in. Our justice agencies, frontline professionals and other staff deal day in and day out with emergency situations and unexpected events. However, even for them, the challenges raised by the COVID-19 outbreak have never been seen before. I cannot praise enough the work that has been undertaken by these agencies and individual staff in both planning for and responding to the COVID-19 outbreak. I will set out this afternoon the approach that we in government, along with our key justice partners, are adopting broadly under 3 headings: maintaining public confidence and safety, supporting and responding to the health advice, and finally, taking necessary but difficult decisions. In terms of maintaining public confidence and safety, on the first of these themes, we've all heard from the Lord Advocate that he has set out that he and the Chief Constable's priorities has emphasised the continuing commitment to keeping people safe from harm and dealing effectively with those who break the law. Let me reassure the Chamber and the people of Scotland that alongside the essential work of our health professionals, Police Scotland and the Scottish Fire and Rescue Service and our wider partners will continue their work to protect the public and communities in their homes. Whilst our justice agencies continue to fulfil this essential role, it is important that they, like all of us, follow the health advice to help contain and reduce the spread of the COVID-19 virus. That is not easy. Many of our justice interactions take place in public and require people to come together in particular locations. It is vital that we are not placing at appropriate risk those who work for our justice agencies and therefore undermining the impact of the public health advice. Last week, following agreement between the Lord President and the Lord Advocate, the Scottish Courts and Tribunal Service announced a programme of immediate changes to the operation of the criminal courts, some of that which we have just heard from the Lord Advocate. A range of other criminal or civil cases, civil business will proceed administratively through correspondence or by telephone conference, etc. We will use digital means where possible to take forward cases in business. But clearly, as the Lord Advocate has already set out, the measures brought forward by the Scottish Courts and Tribunal Service will impact on court business. The Minister for Community Safety is considering the impact of those changes, including to court programmes for solicitors and advocates, and has been working very proactively with the Scottish Legal Aid Board. And can I thank the Scottish Legal Aid Board for thus far showing a great degree of flexibility and the support that they've already announced. The further measures, of course, are proactively being explored. In terms of victims, we know this will be an anxious time for victims. We know that generally, of course, if it approaches potentially a court proceeding, then we know the anxiety that can follow for victims of crime, even more so perhaps in the circumstances that we find ourselves in. So again, the government have been proactive in speaking to a number of organisations that help to deal and support victims, such as Victim Support Scotland, Rape Crisis Scotland and Scottish Women's Aid as well. So we're working closely with them. In terms of our prison service, Presiding Officer, we have in place robust contingency plans for dealing with emergency situations. The SPS's National Pandemic Plan has been implemented and is being overseen by the National Coronavirus Response Group. Local governors in charge are overseeing the delivery of their own plans tailored to the needs of individual establishments, informed by the latest medical advice. As in the community, effective communication is absolutely vital in preventing the further spread of the virus, and the SPS have communicated with every single prisoner, telling them how to avoid infection and advising how the outbreak will impact on their daily routine. Those people in custody who are displaying any of the symptoms of COVID-19 are self-isolating, as, of course, are prison staff. The SPS has established clinically led protocols for testing, and I've been assured that our prisons have secured sufficient access to PPE for staff consistent with those protocols. During this fast-moving situation, the prison service have been considering all necessary steps that need to be taken to reduce the risk of the virus spreading. Effective from today, the Scottish Prison Service will be suspending visits to our prisons. This was a decision not taken lightly, with our prison service and was communicated to all staff, prisoners and partners yesterday evening. We recognise that maintaining family contact, perhaps more so now than ever, is crucial during these challenging times. SPS are working on other options as a matter of urgency in which we can support and maintain family relationships, including establishing a dedicated family helpline, and of course we will look at all digital and telecommunication solutions. More difficult operational decisions may lie ahead, and we're working urgently with Scottish Prison Service and other partners to help mitigate, where at all possible, the impact of these changes. I want to express my personal thanks to frontline prison officers, NHS staff and others who work in our prisons for their efforts in what is always a challenging, complex environment, but even more so in the face of the COVID-19 outbreak. In terms of taking difficult decisions, part of what makes the current situation so unsettling and difficult, I think, is the escalating nature and the scale of the challenge. For many people, there is also an extreme sense of uncertainty about how long the disruption to normal life may last. So part of the function of our justice system is to provide clarity and stability for individuals and communities, especially in times of uncertainty. This is especially important at a time when the capacity of our frontline services will themselves be impacted by the measures introduced to prevent the spread of the COVID-19 virus. Members are aware, and we've already discussed in the previous session, that the UK Government has published an emergency bill to provide additional powers to protect lives and respond effectively to the COVID-19 outbreak. Following dialogue between the 4 UK administrations and joint advice from the 4 chief medical officers, many of the provisions apply on a UK-wide basis, and the LCM for those provisions, of course, will be considered by members today. This includes powers allowing police in Scotland to support and enforce public health measures, including powers to detain people and put them in appropriate isolation facilities if necessary to protect public health. The bill also gives Scottish ministers the powers to restrict or prohibit events or gatherings where incidents or transmission of coronavirus constitutes a serious and imminent threat to public health. I hope that good citizenship and the continued cooperation of event organisers means that we have little cause to invoke such powers. Crucially, there are sufficient safeguards to ensure that any requirement or restrictions placed on individuals through these powers must be necessary and must be proportionate. The measures will also be time limited. But the UK bill, frankly, is likely to be just the first tranche of measures to enable our key services to change and respond in an effective manner to deal with this outbreak. The bill also gives Scottish ministers the power to make public health regulations to enforce measures announced by the First Minister last night. Breaching the restrictions will be a criminal offence, which could lead potentially to a fine or indeed other enforcement actions. These measures are unprecedented, but we must take this action now to save lives, and we do not do so lightly. We do not want to use these powers, and we're working on the basis that most people will act and comply as we've set out. Over recent days, we have been engaging closely with key justice organisations and other partners to consider what further legislative measures may be required, specific to devolved services here in Scotland, and further information about these measures will be shared in the future. Measures will be limited to ones that we in government and our partners consider absolutely necessary in order to respond effectively and promptly to the particular exceptional circumstances of this outbreak. Our clear intention is that those measures will be subject to appropriate scrutiny by this Parliament and will be time limited. But let me be clear, all measures that are necessary to keep our citizens safe, be they in our prisons or indeed out with our prisons, will have to be considered, underpinning our commitment to the rule of law and protecting individuals and our communities from harm. In conclusion, Presiding Officer, I'm confident that members will join me in expressing our continued thanks for those who work within our justice system at this significant time of unprecedented challenge. We'll continue to work with them with the support and capability they need to protect lives, but crucially to maintain confidence in Scotland's justice system.
The Lord Advocate and the Cabinet Secretary will now take questions on the issues raised in their statement. You'll have noticed that the statements have gone over time, and I cannot allow any more than 20 minutes for questions, so it's oversubscribed and very tight, so brevity would be required for fairness sake. And I first of all call Liam Kerr, if you could indicate to whom you wish to address your question particularly.
Thank you, Presiding Officer. I thank both the Cabinet Secretary and Lord Advocates for advance sight of their statement, and in particular the approach that they and their justice teams are taking. I think this will be very reassuring. Time is unexpectedly restricted, so I'll get into three issues, two for the Cabinet Secretary and one for the Lord Advocate for me. With regard to prisons, this is undoubtedly a difficult environment to stop the spread, and I understand protocols are in place. But first of all, what contingency has the Cabinet Secretary considered in the event of a critical number of staff being absent, and what more is being and can be done to limit the spread, especially in prisons such as Barlinnie, where you've got doubled up cells? Lord Advocate, secondly, you said you'd seek extension of statutory time limits in relation to remand. I understand the intention, but wonder for how long he can do that and whether there are any other alternatives being explored that he's prepared to tell us about. And finally, with regard to our police, Cabinet Secretary, is the Cabinet Secretary fully satisfied that our brave officers charged with enforcing the lockdown have enough PPE to keep them safe? And can he reassure the public they have enough officers to enforce that lockdown?
Go to the Cabinet Secretary and then to the Lord Advocate.
Just again, can I thank Liam Kerr also for his approach, and we've had very constructive dialogue over the last few weeks, and I appreciate his approach. In terms of prisons, he's absolutely right, a very difficult environment indeed. Of course, SPS is following the public health advice to the T, but I will be very honest and very frank with Liam Kerr. Every option must be explored. If, for example, our staff absences at SPS continue because of the public health advice, therefore we will have to look at every single measure. And let me be clear, just as the UK Government has looked at releasing prisoners or increasing the numbers on HDC, so too in Scotland we cannot rule out releasing prisoners if that is to the best interest in keeping our establishments safe and those who work in those establishments. So that is something that will be actively explored. In terms of his question in relation to the police, I was talking this morning to the Chief Constable. I understand there's an order of PPE coming in, which will give hopefully further reassurance for those officers. In terms of numbers, he will note the appeal that's gone out for special constables and to their employers to free up their time to work further with the police. And finally, I would say that there's around 350 odd recruits starting at Tullyallen with Police Scotland as we speak.
Lord Advocate.
Yes, I'm grateful for the question. Within the current framework, the legal framework within which we operate, we cannot bring cases to trial in the solemn courts or indeed in most summary cases. It will therefore be necessary for us to extend time limits, and one of the tensions, one of the challenges that we face will be the need for individuals to be detained on remand where public safety requires it. The guidelines I've issued to the police are focusing decisions on custody firmly on the question of public safety, so that where public safety demands it, individuals will be taken into custody, but people are not taken into custody unnecessarily. Beyond that, a range of measures are being considered with government, but it perhaps wouldn't be for me to outline what those are at this stage.
James Kelly.
Thank you, Deputy Presiding Officer, and can I thank the Lord Advocate and the Cabinet Secretary for their statements. Due to the COVID-19 outbreak, we do live in unprecedented times, and it's important that we work together. However, Parliament also exists as an essential platform for MSPs to bring issues to Government Ministers and the Lord Advocate to ensure the response is as comprehensive as possible. I have two questions for the Cabinet Secretary for Justice. First of all, in terms of prisons, this is a sensitive area. There have been reports of an incident yesterday at Addiewell Prison, and I think that underlines the importance that staff must have appropriate PPE equipment. It's been drawn to my attention that staff in the prison escort service don't have that appropriate equipment at this minute in time. So can I ask, when is that going to be supplied, and will it be up-to-date equipment? Secondly, in relation to the police service, what action is going to be taken to ensure that the governance arrangements are in place to ensure that local police decisions fit in with the priorities of the local community in relation to the ongoing outbreak?
Cabinet Secretary.
Can I thank James Kelly for his question? I take absolutely what he says. Of course, this is a chance for us to inform, but also to be scrutinised, and I do welcome that, the approach that James Kelly takes. In terms of prisons, he's right, there was an incident at Addiewell. I was briefed throughout the day regularly from the SPS in relation to that incident. It was resolved last night. What I would say is that it's just an example of the difficult and challenging circumstances we find in prisons right across the country at any time, let alone, of course, these are the most challenging of times. And there was some anxiety. I'm not saying it's related to the Addiewell incident, but a lot of anxiety, I think, from people that visits were continuing, and therefore the decision to suspend visits, I think, absolutely the correct one, in line with public health guidance. But equally, if all family contact was cut without no family contact by means of digital or telecommunications, then I think we would have an adverse reaction too. So SPS is working urgently and proactively to see how we can continue that family contact. In relation to the contract we have with the GOME in terms of policing escorts, I will look into that issue. It hasn't been raised with me as a concern. I'll speak to James Kelly offline if he has any further information, but I will proactively, after this session, speak with our officials in relation to GOME contract and PPE, because they do an important job. In terms of local policing, I will leave that as an operational matter to the Chief Constable, but I know that he greatly values the local relationship that divisional commanders have with the local authorities, and of course that he's absolutely right, James Kelly, to allude to the fact that the response may be different in different geographies and different parts of the country in responding to this outbreak. But the Chief Constable is absolutely clear that his commitment is to ensure that people are kept safe in Scotland throughout this pandemic. That may be dealing directly with issues related to the pandemic, but equally it might be issues that are not connected to that, but are substantially important to local communities.
We'll move now to the open questions. May I ask those who wish to ask one to press the request to speak buttons and remind everyone about the need for brevity, please, and to direct your question appropriately. John Finney, followed by Willie Rennie.
Thank you, President Officer. I can also thank the Lord Advocate and the Cabinet Secretary. Cabinet Secretary, for not the first time, I want to commend the important role that cleaning staff play in our public services, no more importantly as we face this particular situation just now. Trade unions have claimed that a number of private companies, including Serco and Sodexo, are refusing to pay cleaners who are isolating or who cannot attend due to childcare. Can the Cabinet Secretary confirm what discussions he's had with those companies regarding staff at the private prisons? And will he confirm that all staff at those sites and across the prison service will be paid? And finally, that all staff will be tested, please?
Not particularly relevant to the statement that was made, I didn't think. But if you wish to respond, Cabinet Secretary.
I'll just give a very quick response, because I think it probably relates to our private prisons in particular. I haven't been made aware of that situation in relation to cleaners. If that is the case, I would be extremely disappointed because that is not, of course, the message that has gone forward from this government, nor indeed, I should say, from the UK government either. So I would be deeply disappointed if that is the case. So I'll follow the issue up as John Finney has raised, particularly in relation to our private prisons.
Willie Rennie.
Concerned about a potential rise in domestic abuse as we endure this period of lockdown. How do we ensure that there is support for potential victims? How do we ensure we've got enough escape routes, especially if they're confined to the home? And how do we ensure that we're not just leaving them to their own devices?
Humza, Yousaf.
Can I give some assurances? I looked to the Lord Advocate just to make sure I'm being kept right in this, but when it comes to, for example, cases where business will be deprioritised, one area that certainly will not be deprioritised is domestic abuse. And we've said that very clearly. The Scottish Courts and Tribunal Service have said that very clearly as well. So hopefully that gives a good reassurance in around those that are fearful, are living in an abusive relationship and perhaps waiting for that case to come to the court. We've been very aware of this situation. It's been raised directly with me by organisations like Victim Support Scotland and Scottish Women's Aid. Police Scotland are also aware of the situation and therefore are liaising with those organisations, plus their local intelligence that they have. But of course, the new Domestic Abuse Act that came into force only came into force once the vast majority of those officers had enhanced domestic abuse training. So to give Willie Rennie as much assurance as I can, it's absolutely an issue that we are aware of in government, police are aware of, and it will be a case, it will be a matter which the courts continue to prioritise.
George Adam, followed by Maurice Corrie.
Thank you, Presiding Officer. What is the Cabinet Secretary's response to Police Scotland's call to employers to consider paid leave to members of staff who volunteer as special constables to allow them to support the national effort to tackle coronavirus?
Humza, Yousaf.
In short, it would be to support that call. We know the impact that coronavirus, COVID-19 is having on staff right across the justice sector and, of course, wider. Police in Scotland are not immune to that, so they are, of course, they have put out a call, I should say, to special constables and to the employers of special constables to allow them to give them paid leave so they can do more work as special constables, which will help to bolster our police force. So I would add my weight to that call to employers to be sensitive to that call, to heed that call, and hopefully help us all in this national endeavour to combat this virus.
Maurice Corrie, followed by Rhoda Mackay.
Thank you, Deputy Presiding Officer. Can I address this question to the Lord Advocate, please? Will prosecutors require to attend court for a few trials proceedings? And if so, what steps are being taken to protect them?
Lord Advocate.
Yes, I'm grateful for that question. I mean, I should say that the starting point is that the Prosecution Service has, in the past week, taken steps to maximise working remotely and working from home. In the management of the court business, where cases can be progressed without an appearance by anyone at court, they will be progressed in that way, and it's hoped that judicial case management and proactive engagement between the Crown and the Defence will maximise the potential for progressing cases in that way. When it comes to the very small number of trials which will continue, there will be no option but for those required to attend to be at court. It'll be a matter for local arrangements to seek to ensure social distancing so far as possible. So I suppose the starting point are the steps that have been taken to minimise the need for people to attend court generally at this time, and if, insofar as court business has to take place, local arrangements for respecting the social distancing requirements.
Rhoda Mackay, followed by Daniel Johnson.
Thank you, Presiding Officer. My question is to the Cabinet Secretary. In relation to maintaining family contact, can the Cabinet Secretary give an approximate timescale of when new measures such as a helpline, etc., will be available?
Humza, Yousaf.
All I can say to Rhoda Mackay at this stage is the decision was taken last night, and I would look to make sure we have solutions in place in days as opposed to weeks. And already some of these measures can be deployed. We're actively looking at a range of measures The helpline is one of them. We know that technology exists elsewhere in relation to mobile phones that have restricted call lists and other such measures, of course, as well as video conferencing and so on and so forth. So a whole suite of packages is being looked at. Of course, we look at that to retain family contact. Equally, we have to understand, of course, the environment we're working in, and therefore, of course, appropriate risk assessment also has to be in place. But I would give Rona Mackay in the Chamber an absolute assurance this has been done as a matter of absolute urgency.
Daniel Johnson, followed by Sandra White.
Thank you. The Cabinet Secretary for Justice acknowledged the fact that the new restrictions and enforcement of them will place real pressures on both the capacity and availability of both police officers and police staff. But just this afternoon, the Unison Police Scotland Staff Branch stated that key staff roles have yet to be identified by the police. I was just wondering if the Cabinet Secretary could say what communication he has had with the Chief Constable about this, but also generally what steps are being taken to maximise the availability of both police officers and staff at this time.
Humza Yousaf.
The important point raised by Daniel Johnson and around police staff. To give a direct answer to this question, I raised this very issue with the Chief Constable yesterday afternoon and mentioned to him that I'd also heard communication, not directly from the union, which I do tend to meet on a regular occasion, but from a number of police staff that had been in touch directly. He was surprised that was coming in, and he absolutely gave me a reassurance that he would turn his urgent attention to that issue, to the staffing issue. And his communication to me was very clear that they are following the government's guidelines. Therefore, anybody who is able to work at home should absolutely be working at home. While we recognise for some staff that simply will not be possible, he is of the opinion, of course, that where that is possible, he expects that to happen. So I did raise it with the Chief Constable yesterday afternoon, and I'm sure he is working hard on that matter.
Sandra White, followed by Anna Sarwar.
Thank you, Presiding Officer. It's a kind of follow-up to the previous question. Some officers have contacted me and other MSPs, and they're worried that vulnerable members in the police force are being encouraged to continue to work, even if they are symptom-free. Can the Cabinet Secretary clarify what advice senior staff should be giving to vulnerable and at-risk members?
Humza Yousaf.
Well, the advice from government obviously has been very clear in relation to who should be working, but also who should be working at home, particularly the advice from the government, which can be found, of course, on our website, NHS Inform, but also, of course, in a myriad of other places around those who are high risk or deemed to be high risk, and therefore, of course, precautions should be taken for them. I will, again, on the back of both Daniel Johnson's question and Sandra White's question, I will again ensure this matter is raised with Police Scotland directly.
Anna Sarwar, followed by Willie Coffey.
Thank you, Deputy Presiding Officer. Can I ask the Justice Secretary if the Government will be providing guidance to funeral operators, and particularly community organised funeral operators? For example, Muslim and Jewish burials are done with a ritual of washing of the body before a burial takes place. Will there be guidance on what would happen with COVID-19 patients in those circumstances? And if that is to happen in the community by those community organisations, can the government assist them in acquiring PPE equipment so they can keep themselves safe at this really difficult time?
Humza Yousaf, again, I'm not sure it's entirely relevant to the issues raised in the statement, but if you would like to say a few words.
I'm happy to answer the question, only because, although perhaps not into the remit of the Justice Secretary, I do work very closely with my colleagues in Public Health, and Joe Fitzpatrick in particular, but also Anna Sarwar will understand this, and I will. Matters relating to the Muslim community, he and I will often get approached regardless of what our official remits are or are not. Therefore, to answer his question direct, guidance has been provided to Glasgow Central Mosque, who do the vast majority of funerals in the west of Scotland, but I've been told it's now been also passed to the Muslim Council of Scotland, who will then disseminate that information right across mosques. In terms of the Jewish community, I'll have to look that up, but I will ensure that advice is sent to all communities in relation to the specific rituals they have in relation to dealing with the deceased. In regards to the PPE, that hasn't been raised with me yet by the likes of Glasgow Central Mosque. They're never shy to be on the phone to me if there is a matter of concern, so I will pick up the phone to them. And of course, if the government can assist through the work that we're doing in relation to PPE, then of course we'll try to be as helpful as we can in that regard.
Thank you, Cabinet Secretary. Willie Coffey, followed by Claire Baker.
Thank you. Can I ask the Cabinet Secretary for reassurance about safety of the staff and prisoners at Bowhouse Prison near Kilmarnock, given the positive confirmation last week of 2 cases of coronavirus amongst the inmates?
Humza Yousaf.
Well, given assurance that when it comes to our policies, regardless of whether the prison is run in the public sector or indeed run by a private company, the strict public health guidelines are being followed. The clinical protocols are also being followed. And of course, in relation to the 2 positive cases in HMP Kilmarnock, they were also the correct protocols, I can confirm, were absolutely followed in that regard. But it does give me cause for concern. We know how infections and viruses can spread rapidly in a prison setting, and therefore, as I intimated in my response to Liam Kerr's question, we will have to explore a range of measures, and of course, some of those we have the powers to enact now. We may have to think about those matters where we do not have powers and whether we have to return potentially back to this Parliament in that regard.
The last question is Claire Baker.
Thank you very much, Presiding Officer. The cancellation of jury trials will have an impact on those who are the victims of rape and sexual assault, and as already raised, there are serious concerns about the potential for the increase in domestic violence. Can the Government keep a close watch on the situation and provide whatever resources necessary to protect and support women and children, some of whom are in the midst of a very stressful and upsetting court case?
Lord Advocate.
Perhaps I can comment first, and then the Cabinet Secretary may wish to add his own response. I am acutely conscious of the matters that Claire Baker's referred to, specifically in relation to domestic abuse. I can elaborate on what the Cabinet Secretary said a few moments ago, that the rigorous approach to domestic abuse set out in the protocol between the Crown and the police on domestic abuse will continue to apply. And where there is a substantial risk of harm to an individual, the police will continue to take accused into custody. And the guidelines I mentioned earlier enjoin the police to be mindful of the particular issues which arise in the context of domestic abuse. And indeed, if an accused is not taken into custody, the police are enjoined to consider the use of conditions to protect public and individual safety. And of course, courts will continue to make decisions about remanding accused in custody. I think it's perhaps important I do emphasise that decisions on remand ultimately in this difficult situation will be for courts. But where an accused is not remanded, the Crown will seek appropriate conditions of bail to protect public and individual safety. In relation to jury trials generally, the current legal framework does not allow us to bring a solemn case to trial other than before a jury. And accordingly, at this time, there is no option but to simply defer those trials unless and until the public health guidance allows us safely to recommence the impanelling of juries.
The Cabinet Secretary is desperate to add something. Quickly, please.
No, I was trying to indicate the very opposite. Other than just say to Claire Baker, we'll continue our engagement with those victims' organisations. If there's anything further the Government can do in this regard, because we understand domestic abuse could be at a higher prevalence during this outbreak, then we will do that.
That concludes questions on the Justice Statement in relation to COVID-19. Apologies to those who would have liked to have taken part. I couldn't reach you. And we'll move on to the next item of business. The next item of business is debate on legislative consent motion 21322 in the name of Michael Russell on the UK coronavirus bill. May I ask those who wish to speak in the debate to press the request to speak buttons, and I call on Michael Russell to speak to and move the motion. Up to 5 minutes, please, Cabinet Secretary.
Thank you, Presiding Officer. Less than a week ago, I updated the Chamber on the introduction by the UK Government of the coronavirus bill, setting out the measures the bill contains and how it will assist and support our responses to the current pandemic. On Friday, the Scottish Government lodged the legislative consent motion with the Parliament in respect to the bill. This afternoon, members are now debating the motion and will be asked to give it its consent with the recommendation of the Scottish Government. I acknowledged in my statement last week that timings around the development, introduction and scrutiny of the bill had been and would continue to be extremely challenging. The UK Government's stated ambition was to have the bill receive royal assent by the end of this month. This has now been accelerated in view of the current scenario, and the intention is for all stages of the bill to be completed by tomorrow, when royal assent will hopefully take place. Last week, I gave a commitment to the Scottish Government that we will institute, after discussion across the Parliament, appropriate reporting on how and when the powers in the bill have been used by the Scottish Parliament. In addition, in our own further emergency coronavirus legislation, next week I intend to embed such reporting and renewal for every 6 months included in our use of provisions in the UK bill in law. I'm glad to say that since our discussions last week, the UK Government has heeded the concerns that have been widely raised on the 6 months issue, and I understand are implementing that in their bill. This bill, Presiding Officer, is a result of a great deal of intensive work between the Government and the devolved administrations. We must continue that mutual cooperation as we work collectively as part of our four nations approach to confront the extraordinary public health and economic challenges posed by the coronavirus pandemic. But we will also take the actions we regard as necessary for the special circumstances in Scotland and to put those in place. And it's to those that I want to turn now. The First Minister has made it clear, and I want to repeat, that in creating the additional powers in this bill, we did not and do not mean automatically to use them. We'll be guided by the decisions at the appropriate time, and any enforcement action that we take will be taken as a result of the situation actually pertaining here in Scotland. Of course, since I gave the statement last Thursday, the Prime Minister and the First Minister have, as part of our response, set out further social distancing measures, the latest to have been implemented with immediate effect from midnight last night. The restrictions now in place will be difficult, sometimes distressing. They will always be strange to us. But these new measures are for the protection of us all, and they are essential, and I repeat, essential, to slow down the spread of the virus. From today, the message to all our citizens is clear. People must now stay at home. The more people that comply, the less impact there is on the NHS, and the fewer people will die. We're now clearly telling all citizens those facts, and there's a very restricted list of activities. Leaving the house is permitted to go shopping and for one form of exercise a day, but this must be severely restricted, and the exercise is expected to be undertaken alone or with your household. Leaving the house is permitted for any medical need, to provide care or to help a valuable person, and to travelling to and from work where that is absolutely, and I stress absolutely, necessary and cannot be done from home. Now, we have been explicitly clear that beyond these permitted activities, heavy restrictions now apply. All non-essential retail outlets will no longer be allowed. All social events, weddings, baptisms and other ceremonies are also no longer permitted, and communal places such as libraries, playgrounds and places of worship will close. Funerals must be restricted to immediate family. We'll shortly issue a list of premises covered by these new measures, but we urge everyone to do the right thing now. Most have, but we are, and I stress this again, committed to use the powers available to us, and we will. We have therefore, Presiding Officer, now taken the decision, as part of our response, to commence upon royal assent the powers within the bill, which will ensure that all necessary enforcement action can be taken to implement social distancing and restrictions on gathering, events and operation of business activity without further delay. And to do so, following the point at which the bill completes its parliamentary process and receives royal assent, which is likely to be tomorrow, we will immediately bring forward regulations under the emergency procedure in this Parliament. These regulations will be made in what is now Schedule 19 of the bill, which confers the same powers on the Scottish Government that the UK Government already has under Section 45C of the Public Health Control of Diseases Act 1984. Those powers allow us to make emergency regulations where we believe there is an urgent need for them. We believe there is an urgent need, and we will make those regulations now. That means those regulations will come into force immediately and will remain in force, providing they are approved by Parliament within 28 days of being made. so we will seek parliamentary approval as soon as possible for that timetable. Of course, we will keep them under constant review in line with our scientific advice and will assure Parliament is kept informed of our legislative approach as things progress. And I will be meeting, I think, opposition spokespeople later this afternoon to talk about the next bill we intend to bring. Presiding Officer, when I addressed the Chamber last week, I said we must put in place what we need to do the right thing for everyone, to take action to protect, to enhance and strengthen not just our response, but ourselves. I think the measures we have taken are proportionate but essential. But last week also, in conclusion, Presiding Officer, I drew attention to the fact that pandemics have been experienced before. Each time there is fear, there is dread, there are difficult decisions, and yes, there is death. But there's also courage and hope and determination. We learn from those who have gone before us, because they made it through and they told the tale, and we intend to do the same.
Could you move the motion, please, Cabinet Secretary?
The motion in my name.
Thank you very much. I now call on Bruce Crawford on behalf of the Finance and Constitution Committee for up to 5 minutes, please.
Thank you, Presiding Officer. We find ourselves in quite exceptional circumstances, considering a bill and a legislative consent memorandum that seeks extraordinary powers in an effort to keep our communities, our families, all of us safe. I think we all know governments would only normally be seeking such powers in times of war. We also know that right now we are in a war against an unseen and deadly enemy. As a result, MSPs and MPs are understandably inundated by emails and calls from constituents. Constituents anxious, concerned and scared about the impact COVID-19 may have on their health, their families, their friends and their livelihoods. The bill and its accompanying LCM aims to help governments to support and protect us at this time of great need by increasing the available health and social care workforce, easing the burden on frontline staff, containing and slowing the virus, managing the deceased with respect and dignity, supporting people and maintaining the food chain. In view of the wide range of powers in the LCM, the Finance and Constitution Committee was designated as the lead committee as we considered the Coronavirus Bill, LCM, this morning. I can confirm that the committee has recommended to Parliament that it should agree the draft motion as set out in the LCM. We have written to the Scottish Government confirming our decision. The LCM covers a wide range of policy areas, including health, social care, justice and business. The LCM identifies that the powers will come out operational in a variety of ways. In some areas, existing legislation is amended so that powers will come into force upon enactment. In other areas, the powers will only become operational once certain conditions are met. For example, Scottish ministers will be able to give directions to impose restrictions in relation to events, gatherings and premises. In relation to those areas where the powers may be more reactive to changing circumstances, I would welcome information as to how the Scottish Government is working with others, such as the local government and the police, to help inform its decisions on when to implement these powers. At the committee this morning, the Cabinet Secretary dealt with a very significant range of issues, and I think was able to respond concisely and with clarity, from matters about who is a key worker to the security of food supplies, from the impact on the vulnerable to the need for employers to act responsibly. As the Cabinet Secretary explained last week, creating these powers does not automatically mean that they will be used. He repeated that again today, or that all the powers will be implemented at the same time as the bill gains royal assent. And the bill does tread a fine line between allowing flexible public health response and ensuring that human rights and civil liberties are not unnecessarily infringed upon. And key to ensuring this balance remains appropriate will be the transparency which these additional powers are in practice exercised. And key to ensuring that this balance remains appropriate, we need this, as the Cabinet Secretary said this morning, now is the time for democratic process to be stepped up. Presiding Officer, this LCM seeks to enable the Government and allow it to react quickly, to protect us, and in particular those most vulnerable to this terrible virus. It seeks a wide range of powers, but these are unprecedented times. I would urge members to support the motion. Let's give our governments the powers to help them win the war against this unseen and deadly enemy. And can I say to the people of Scotland, stay safe, keep well, and let our marvellous NHS do all their powers to save us. And please, stay at home when you can.
I call Bill Bowman on behalf of the Delegated Powers and Law Reform Committee for up to 4 minutes, please.
Thank you, Deputy Presiding Officer. I speak as convener of the Delegated Powers and Law Reform Committee. We discussed this bill at our meeting this morning, though of course, given the urgency of this situation, our consideration was limited. The committee is interested in this bill in relation to the powers to make legislation that are being delegated to Scottish ministers. Of these, the power that the committee considered to be the most significant was that which allows Scottish ministers to make regulations for the purpose of preventing, protecting against, controlling or providing a public health response to the incidence of or spread of infection or contamination. This power is necessarily broad, given the wide range of responses that may be required to control an outbreak. However, the bill puts in place important and appropriate restrictions on the use of the power. The committee is also reassured that the affirmative procedure, or made affirmative in cases of urgency, applies. This, we think, strikes the right balance between allowing government to act quickly and allowing Parliament to scrutinise these actions. There are also significant direction-making powers being delegated to Scottish ministers in this bill. While this is not something that the committee must consider in relation to LCMs, it is something that the committee would have liked to explore more under ordinary circumstances. We are, however, mindful of the extreme circumstances in which we are currently operating and the need for government to act swiftly. The committee also notes that the substantial powers delivered by the bill, both legislative and direction-making, are appropriately time-limited to a specified emergency period. This will allow the government to act to address this unprecedented situation, but does not allow these powers to be retained indefinitely. The committee considers this an appropriate balance. These are unprecedented times, and we hope that these powers can help government in addressing this pandemic. Thank you.
Call Murdo Fraser for up to 4 minutes, please.
Thank you, Presiding Officer. This will be a short debate, so I'd like to make a brief contribution on behalf of the Scottish Conservatives and signal at the outset that we will support the legislative consent motion at decision time this evening. It is, in my view, essential that both the UK Government and the Scottish Government have the emergency powers they need to tackle the unprecedented national crisis that we are now facing. The UK Parliament bill that this LCM relates to is aimed at protecting the nation's public health and ensuring that NHS and social care staff are supported to deal with significant extra pressure. It also contains a number of measures to ensure that the public are protected. As Bruce Crawford said earlier, in normal times there would be concerns about the reach of some of the measures before us. There would be perfectly legitimate concerns about civil liberties. I fully recognise and understand these concerns, and under normal circumstances many of the powers contained in this legislation would not be deemed acceptable. But we are not dealing with normal circumstances. We are dealing with exceptional circumstances, and it is right that governments do have the powers contained in this bill, powers which normally, in a liberal democracy, we would believe would go too far in the balance between individual freedom and the power of government. And a good example of that is what the Cabinet Secretary just signalled in terms of the emergency powers he intends to take to restrict public gatherings to avoid the spread of infection. In normal times, we would regard that as overreach by government. In these times, it is a necessary step to take to protect the public. The measures in this bill fall into 5 categories. containing and stopping the virus, easing legislative and regulatory requirements, enhancing capacity across essential services, managing the deceased in a dignified way, and supporting and protecting the public. It is important to state that there are many powers government already has to deal with the situation we are now in, where legislation is not required. It's also important to state that the bill is time-limited. Initially, it was proposed that this would be for 2 years, and there were, of course, concerns, quite legitimate concerns, about whether that period was appropriate. And like the Cabinet Secretary, I am pleased that the UK Government has now agreed that this period should be reduced to 6 months, with a provision that this should be extended if possible. And that's a very welcome approach and shows that the Government has been listening to the concerns that were raised. Crucially, this is also a bill that respects the devolution settlement and has been drawn up with the full agreement of and in consultation with the Scottish Government and the other devolved administrations. Presiding Officer, there's a great deal I could say about the detail of the bill before us, but what we've already heard in this debate from the speakers before me gives us a flavour of the measures that are required. They are, in my view, appropriate, proportionate, and only to be used where strictly necessary. And I think these principles should also underline our own legislation here in this Parliament, which the Cabinet Secretary will introduce next week. It needs to be proportionate, it needs to be evidence-based, it needs to be as tightly drawn as possible, and it needs to be time-limited. And I think that's important, given the lack of opportunity there will be for detailed parliamentary scrutiny and for external consultation about the impact of the measures being proposed. Presiding Officer, a priority in the bill is the protection of life and ensuring that NHS and social care staff are supported to deal with the significant extra pressure they are under. We do need to remove the bureaucratic hurdles that stand in the way of bringing new people into the NHS, including those who are recently retired, and ensure that hospital space is freed up and frontline staff are given the space to focus on caring for the sick. Presiding Officer, I said at the outset we are living in unprecedented times. These require an unprecedented response, where the whole of the United Kingdom works together to tackle the crisis before us. It is essential that the peak of the virus is delayed, preferably until the summer months, where the NHS is typically under less pressure. These measures in the bill today will help achieve that outcome, and for all these reasons, I believe that Parliament should unanimously pass the legislative consent motion before us. Thank you.
Alec Rowley, up to 4 minutes, please.
Thank you, Presiding Officer. Labour will also be supporting the Government today, and I would want to put on record my thanks to the Cabinet Secretary for the cross-party dialogue that has taken place to date with this bill. I think it's important, as he brings forward the Scottish Government's bill, that continues, and I know that he intends to. As the First Minister said earlier today, given the type of legislation that we are putting through and the speed at which we're doing it, it will be important. Scrutiny will be important more now than ever. And I think that's why Richard Leonard's right to say that although we are not calling for additional meetings to take place within this Parliament, the very idea that this Parliament would go off on a 2 weeks recess in the middle of this crisis, I think would not be seen well by the public. We should be able to hold the Government to account in whatever form or shape that needs to take. So I think for the powers that be, that's an important message that we need to send across. I do believe that there is still a lot of uncertainty out there when it comes to key workers and who are key workers, and it's important that we continue to monitor. I accept that everything that's happening is happening with the best intentions to deal and tackle with this crisis. But that said, we need to be able to keep on top of, and where things are not working, then address them quickly. I mentioned to the Cabinet Secretary this morning that I'd been contacted by the joint trade unions in Fife, who were very concerned that their members on the front line of health and social care did not have the proper protection and the resources to be able to do that job. And as they pointed out to me, that's a risk for their members, for the vulnerable people that they are caring for, and for all their families. So that needs to be addressed. But we also need to understand about the supply chain and who it is that's coordinating and ensuring that coordination. And it's right that every individual elected member in this chamber is able to push and ask those questions and raise concerns directly where these issues are coming up. I was pleased that the Cabinet Secretary said this morning that the Health Secretary had already reached a deal with the private sector and private hospitals in Scotland, and if that is the case, that is good, because the whole resource of Scotland needs to be pooled together. But there are within this bill powers, the food chain emergency liaison group, etc. But we need to keep an eye on. People have panic bought over these last weeks or so. If that doesn't stop, then we need to be clear that we are willing to take whatever action is necessary to put a stop to that. And we need to also be having a good relationship with the supermarkets. But, you know, for the number of elderly people that have emailed me saying they're having difficulties in accessing food, if some kind of priority scheme was put in with the supermarkets in delivery, and if necessary further resources for councils going in to make that happen, most people who are self-isolating would be able to access the food. It's not for lots of these people that they've not actually got the money to buy the food. It is that they just can't get access to the food. So there will be practical things that I believe, if we sit down with the supermarkets and push them and work with them, we'll be able to address. With that, as I say, I'm pleased with the cross-party working that is taking place on this. Let's keep it up there, and let's get the message out to people that to act collectively and sensibly.
Patrick Harvey, up to 4 minutes, please.
Thank you, Presiding Officer. The Greens will also support the legislative consent motion. And I say that as someone who's got a long-standing grievance, and I know that word is sometimes used pejoratively, with the legislative consent process. I think it's been made relatively meaningless in recent years. But in these circumstances, I think we have a responsibility to take the legislation seriously, and we will agree to the legislative consent motion. I don't think any of us should be happy doing so. This is not the kind of bill that any of us would wish to be passing, but it is necessary. I don't pretend, though, that it's ideal even in these circumstances, and there was much that I was looking for when I saw the bill for the first time that isn't in there. I would have wanted not just an expansion in the eligibility for statutory sick pay, but an increase in the level to that which is closer to something that's livable that a lot of our neighbouring countries already have. Better still, the application of a universal basic income as the clearest and simplest way to give everybody a basic safety net in these emergency circumstances. That's not in there, and I would urge anyone who has colleagues at Westminster, as I have one colleague in the House of Commons, to make the case for improvements to the bill on this and other matters. I was surprised to see that in relation to food supplies, there are only provisions in relation to the providing of information. And I don't know whether we'll be in a situation in the coming weeks when public authorities will need to have the power to acquire stocks of food or other emergency supplies, such as hygiene supplies, to distribute them to the public. But it may be possible that we'll need those powers. Certainly there is a need for measures to prevent price gouging and exploitation of those who control those supplies, which I don't think at the moment applies to the big retailers, but we've all seen it happening in some places where certain absolutely critical supplies are being price hiked. I've made reference before to the emergency volunteer provisions, which are in the bill, which give a commitment that there'll be remuneration for loss of earnings for those who sign up as emergency volunteers. But of course, we already know there are people who've already lost their jobs, who will be available and willing and potentially skilled and talented people to be emergency volunteers, there's nothing in the bill that allows remuneration for them. That would meet their economic need as well as the social need for those volunteers to be available. And I would also encourage the government, I know this isn't part of the devolved aspects that are covered by the LCM, but in the government's discussions with the UK government, I would encourage them to make the case to ensure that our asylum seekers in Scotland and elsewhere are protected. Detention, deportation, these things are frankly intolerable in the current circumstances. They would be deeply dangerous. And for anyone in asylum accommodation to be faced, as they have been in recent months, with the prospect of lock change evictions would also be intolerable. I agree that we have there's welcome changes to the renewal period, but there are other potential unintended consequences of this, and members will know that the Commissioner for Children and Young People, many disability and care organisations and others have talked about the fears that are being generated. None of us know how long these emergency powers will last, and those people, including many disabled people, whose quality of life is directly dependent on how the law deals with these issues, have genuine fears about what is to come, and the Scottish Government must address those fears and allay them. Finally, Presiding Officer, I do very warmly welcome the announcement that we heard earlier today from Aileen Campbell that the devolved emergency legislation will include provisions on ensuring that evictions in the private rented sector and elsewhere do not take place. We'll work with the Scottish Government to improve those provisions if we can, because this is not just about the accrual of arrears. We don't want people coming out of this process with unpayable debts. We want to make sure that people are protected in terms of rents as well as a secure home to live in these dangerous times. Thank you, Presiding Officer.
Willie Rennie, up to 4 minutes, please.
I thought Bruce Crawford summed it up very well to start off with when he said this was an unseen, deadly enemy and that we need to work in partnership to defeat it. I thought he summed it up very well. To stay home, protect the NHS, save lives, the kind of slogan that I think will become part of our daily language over the next few months. We need proportionate powers, and we agree that these powers in this bill are proportionate, considering the crisis. As a Liberal, I'm nervous about the extent of powers in normal times, but I think considering the challenge, I think this is what is necessary. It's not to wield a big stick to the population, but to ensure life is possible and to ensure that the reckless few cannot threaten the lives of the many. It is therefore reassuring that the Minister and the Government will seek the 6-month renewal process and that will only use the powers when they determine that it is absolutely necessary in Scotland's circumstances at the time. That is reassuring, and the fact that the Minister will come back on a regular basis and to report on how these powers are being used and exercised. I welcomed the announcement yesterday from the UK Government to go for the 6-month renewal as well. I thought that was a sensible compromise and an indication of, I think, the partnership approach that we've got across the parties and across the parliaments, right across the United Kingdom, addressing this crisis, and that is in no doubt welcome. In addition to the measures to protect us from the reckless few, it is also about adopting more flexibility in the way that government works and improving standards too. So I would like the Minister to perhaps address some concerns from organisations like Inclusion Scotland, who are anxious about the issue of care assessments. I know that the packages can proceed without the care assessments, but these care assessments are there for a purpose. They're there to provide a comprehensive assessment of all the individuals' needs, these vulnerable people. So if it's possible to do the assessments, I hope the Minister will encourage those people applying the assessments to do so. We understand that we'll be under inordinate pressure over the next few months. But if the assessments can be done, we should encourage them to be done, because I think everybody will benefit from that process. The Scottish Specific Bill is coming next week, and I appreciate the engagement from the Minister, the discussion that we had last week about what's going to be in the bill itself. Does the Minister believe that that bill itself may provide some kind of process to address any emerging flaws that come from the UK bill? And I understand that the there may be other legislation coming forward in future weeks, and I hope perhaps that we adopt that learning approach, that if we discover that improvements can be made, that we do accept that in future legislation. And finally, I look forward to the day that we can repeal this legislation so that we can return to the freedoms that we all enjoy. I think it is important to understand during this quite oppressive period that for a long time we have enjoyed those freedoms, and the sooner we get back to them, the better. Thank you.
We move to the open debate. The speeches of 4 minutes, please. John McAlpine, followed by Ruth Davidson.
Thank you, Presiding Officer. If anyone has any doubts that this bill is necessary, I would just say...
excuse me, Ms McAlpine, pull up your microphone.
Apologies.
Start again. Thank you.
If anyone has any doubts that this bill is necessary, I would say just one word, and that is Italy. Italy has an excellent health service, not unlike our own NHS, and the country's latest tally reported a total of 6,078 deaths from 63,928 infections. But the headline figures themselves do not tell the whole story. The people who die in Italy die alone among strangers without the comfort of their loving families, as they will here if our NHS is overwhelmed. For some people, dying alone is a prospect more frightening even than death itself. But that's the inevitable consequences if we don't take action. We must stay at home, and those who don't stay at home should be compelled to do so. The bill itself is extensive, and I cannot address each part of it, so I'll touch on 3 areas quickly. I commend the measures to enable the registration of doctors and other health professionals, and I want to draw attention to the briefing from the BMA on this part of the bill. They have written to 15,000 doctors to let them know that they expect the government to use their powers to ask the BMA to temporarily register them, and 1,500 of those have a registered address in Scotland. I think we need to look at that in the context of Italy again, where 14 doctors have already died and 3,700 doctors and nurses have already been infected on duty. And I just want to say one thing to those doctors and nurses who are going to register again and the ones already in our NHS. Thank you so much. The Cabinet Secretary says we will not necessarily use all the powers that the bill enables, but I know that ministers do need to use powers to protect these workers and that this Parliament supports them. I also wanted to touch on the powers in relation to food security. Those from reading the bill seem to focus on the sharing of information. I welcome that, but as I said earlier in my question to the First Minister, there really is a concern about the getting food to elderly and vulnerable people, particularly through home deliveries. And if we need to use powers in the bill, indeed if there are powers in the bill to enable ministers to intervene in that area, I think I would support them. And judging from comments from other members of Parliament, I would certainly support the use of those powers to ensure that the food goes to the people who need it. One aspect of the bill that does concern me, and others have raised it, is the care of the most vulnerable. And I note the briefing from Inclusion Scotland that represents people with disabilities. Clauses 15 and 16 of the bill are intended to increase flexibility for social care decision-making during the period in which the provision is in force. And it does this by allowing local authorities not to comply with the particular assessment duties where complying would not be practical. However, Inclusion Scotland warn that in reality the removal of these duties may result in many disabled people receiving social care support that is inadequate to meet their needs, receiving care that's inappropriate or in inappropriate settings, or maybe even receiving no social care at all. But we're already hearing anecdotal evidence about the knock-on effects on social care packages from the current crisis, and I would implore ministers to keep a very close eye on this and other unintended consequences that could affect the most vulnerable. Yes, there are human rights implications, but the ECHR allows exceptions when these are proportionate. I am very, very pleased that the amendment went through, which means that the legislation will be revised in 6 months. I wouldn't underestimate the profound implications on our human rights, but at times of national emergency, this is necessary, and this is a time of national emergency. I think it was Bruce Crawford earlier on that compared this this current situation to a war, time of war, and I would agree with that. And this bill is designed to protect our frontline troops in that war, and that's why I support it. Thank you very much.
Ruth Davidson, followed by Pauline McNeill.
Thank you, Deputy Presiding Officer. For me, this bill and the legislative consent motion that we debate is about one thing and one thing only. It's about trust. It is about trusting the UK and Scottish governments to make decisions on behalf of all of us. And more, it is about handing the current inhabitants of Butte House and Number 10 unprecedented power and trusting them to wield it wisely. It is about trusting our police when handed enormous powers of shutdown, of penalty and arrest at a time of reduced scrutiny, to wield those powers virtuously. And it is about trusting individual officers to practice self-restraint when far fewer external checks are placed upon them. We are asking the public to trust their politicians at a time pre-COVID when trust was a vanishing commodity, when the Ipsos Mori Veracity Index recorded politicians as the least trusted profession of all, behind bankers, journalists and estate agents. It is about recognising that behind the job title of politician are people who are every bit as worried for their family, concerned for the nation and desperate to keep the death toll to a minimum. And it's about recognising that the trust you put in them does not exist in a vacuum. Those politicians, in turn, are having to trust each other. Boris Johnson, Nicola Sturgeon, Mark Drakeford, Arlene Foster, Michelle O'Neill. 5 people, 5 different parties, 5 political heritages in conflict with each other, who have put old enmities aside to ensure that we pull together in a 4-nation strategy in order to have the best chance of getting through this. Whose trust in the decisions that they are having to make is reinforced by the trust that they have in the people who are advising them. The Chief Medical Officers, Chris Whitty and Catherine Calderwood, the Chief Scientific Advisor, Sir Patrick Vallance, the National Clinical Director, Jason Leach. The measures we are trusting governments to take go far beyond anything that in normal times we all believe is appropriate for Western liberal democracies to still be called such. But these are not normal times. One of the reasons that I'm a Conservative is because I believe in the agency of individuals, that in a democracy, sentient adults should enjoy the freedom to make decisions they feel are best for themselves and their family, as long as they accept responsibility for the decisions that they take. I don't accept the creeping hand of state bureaucracy into every area of my life, stifling and suffocating free expression. In a world of competing philosophies, I find myself in personality and belief and in conviction closer to Mill's harm principle, where the state shouldn't intervene except to stop harm to others. But all of this is suspended as we turn to face this enormous invisible wave which is about to wash over all of us. This is no longer a time to argue for the exercise of individual freedoms. It is a time to accept that the best route to the greatest freedom of all, life, is utilitarianism. I believe that the only moral position we have is that decisions taken in the weeks to come can only be decided on what will produce the greatest good for the greatest number. When a threat is so great, when it is so overwhelming, then the state is the only actor that is big enough to co-opt, coordinate, compel and direct all the multicoloured strands of our response. We have to give over our freedoms, purposefully and willingly, to the government and trust them to keep us safe. And after that great wave has receded once again, we have to trust them to hand those freedoms back. Presiding Officer, I thank the Ministers of both government for the work that they are doing on all our behalves. I trust them to exercise the power and agency that I hand to them as a citizen of this country judiciously. And I ask them, please, to do their best work and to keep our families and our communities safe. Thank you.
Pauline McNeill, followed by Anna Sarwar.
Thank you, Presiding Officer. I want to begin with a heartfelt thanks to the committee, to all the government ministers, the First Minister, and Aileen Campbell in particular this afternoon, who I think made the right decision on no evictions. We live in the starkest of times, as Joan McAlpine said earlier, and we need the fullest extent of our powers now, our resources, our joint working. But as we've heard, people are still going to work and disobeying the guidance only this morning. And so the message must get through loud and clear today that you can no longer do that. If there's one power that I could add to prevent even further chaos, is a power to prevent traders, a small number of traders, who are escalating the prices of basic goods like hand sanitizers and toilet rolls in the middle of an unprecedented crisis. And I asked the Minister, would it even be possible to consider this? State intervention would be justified, in my view, in this crisis. As Ruth Davidson says, the legislation must be clear, it must be constantly reviewed, because we live in difficult times. And the Minister rightly says we act as 4 nations working together cross-party. The public expect clarity. They expect an understanding on why there's a lockdown for 3 weeks. And so we need emergency powers and new powers to ensure that we can function in these difficult times. With all the pressures and burdens on ministers and officials, we do need regular updates and reports on a number of things. Some of those things include, with the legislation talks about mental health orders, for example. Transparency in planning and contingency decisions are paramount to retaining public trust. The third sector has put out a particular plea as they're very concerned about resources, and there's an important briefing by the Alliance. Let's not forget the important work that our third sector do. Just some of the things that this bill does: has the powers to close schools, school boards, school accommodation for quarantine purposes, for the use of educational establishments and for public health protection. It confers powers on constables and immigration officers who can be enlisted to remove potential infections persons to a suitable place for screening. There can be a period of detention for up to 24 hours, and the person must be informed for the reason for their detention. It can apply to a child, and the requirement rests in a responsible adult. A person committing an offence, if they fail without reasonable excuse to comply with any of the directions, the reasonable instructions can be forced to do so. Scottish ministers may give directions relating to events and gatherings in premises, as we've heard, but it's important to get across to the public that these are powers that can only be used in the middle of this public health crisis. And I think Ruth Davidson made a really important point. We must reassure the public that it's a temporary measure until we're over this, and at the end of it, normal society will continue. Clause 34 modifies Section 40 of the NHS Act, talking about vaccinations and immunisation administered by medical practitioners or persons under their direction to be removed, and that is to broaden the arrangements that Scottish ministers can make, if necessary, to decide who can immunise and vaccinate people. In conclusion, Presiding Officer, the bill, as Bruce Crawford says, creates a fine line between protecting lives and normal freedoms and human rights. We hope and believe this will be temporary and that normal life will resume if we all work together, believe together and stay at home and support our medical services in doing amazing work during this crisis. Thank you.
And the last of the open debate contributions is from Anna Sarwar.
Thank you, Deputy Presiding Officer. And I realise time is short, so I'll keep it very brief. Just to raise some direct concerns with the Minister. Of course, we support the legislation, but to say that we should review after 3 months, not just wait for the 6-month period, but actually a full review after 3 months. Secondly, the Minister will have seen there was concerns, particularly in England and Wales, around the proposal of forced cremations. I'm glad there's been an amendment to that legislation. Can he give a commitment and a guarantee that there will be no circumstances in which anyone will be cremated against their family's will here in Scotland? I think that would be a reassurance that we welcome. Third, I welcome the Food Chain Emergency Liaison Group that is part of this legislation, although, as Patrick Harvey has pointed out, it's about communication rather than actually forcing the staying open of supply chains. Will the Scottish Government and indeed Scottish associations be part of that Food Chain emergency liaison group to make sure there is a free flow of supply up to Scotland. Fourth, there is issues around human rights. So there's clearly issues around sectioning of individuals around the Mental Health Act. There is issues around what's reported to the Procurator Fiscal when there is a death in the NHS setting. There are issues around the emergency registration of health workers. There's issues around fast-tracking of Disclosure Scotland applications and the load that might be put on to all of that. What work has been done to make sure we can safeguard and maintain human rights at a time when we're asking people to do so much more with less and less workforce? And if there is a real increase in the number of applications going into Disclosure Scotland, what backup measures have been put in place to make sure there's an adequate workforce to be able to do that important work so we can get people on the front line as quickly as possible. In conclusion, this is legislation that, again, we don't want, we don't wish we had to introduce, but it's important legislation nonetheless to make sure we have the right response to this crisis. And I hope, like has been the case up until now, we can continue to have the active dialogue between members of this Parliament and the Scottish Government and the UK Government. If any unintended consequences were to take place from this legislation, that they could be addressed appropriately.
We move now to the closing contributions, and Monica Lennon, followed by Adam Tompkins. 4 minutes, please, Ms Lennon.
Thank you, Presiding Officer. The Cabinet Secretary opened this debate by saying that the restrictions that came into effect at midnight last night will feel difficult and strange to many of us, but I agree with him that those measures and the powers in this bill are essential to slow down the virus. Responding for Scottish Labour, Alex Rowley has made clear that the Government has our full support in the battle against COVID-19. And I know in recent weeks, many of us in the public have talked about possible draconian measures and talked about lockdown as something scary, but I think Willie Rennie expressed it really well on behalf of the Liberal Democrats when he said it's not about wielding a big stick, but making sure that life is possible. And I thank Bruce Crawford and the committee for their work. Bruce Crawford was right to say that these are extraordinary powers and that our democratic processes need to be stepped up at this time. And he is right that the bill treads a fine line between public health and our civil liberties not being infringed upon. And others have talked about trust and about transparency and about scrutiny to make sure that we get this right. And I think Ruth Davison was right to say that these are unprecedented powers, but we all understand why and support the government's endeavours. Murdo Fraser was right when he said that the NHS and our social care staff, this bill is about supporting them to make sure that they can deal with the additional significant pressures that are coming their way. So yes, I agree with other members that in normal times this would be overreach, but these are not normal times. There are safeguards. The bill is time limited and will be renewed every 6 months, and colleagues have talked about their willingness to uphold our democracy and to be involved in that important scrutiny work. We will continue to ask questions. A number of colleagues have touched on the questions and concerns that have been raised outside the chamber, including from Alliance, Scottish Care and many mental health charities. So we know that we can't take our eye off the ball. The emergency legislation covers a range of areas, and that's because the health service alone can't solve this crisis. The purpose of the legislation is to relieve pressure on our health service. That is the driving force, so that as many lives as possible can be saved. But it's clear we need a collective approach to this crisis, and that will require every part of government to work together and all of us to support that work. I know that time is short, Presiding Officer. Many colleagues have touched on really important issues just a moment ago, and asked Sarwar seeking that clarity and that reassurance for some people in our community who are concerned about the provisions in the bill which change burials and funerals as we know them. This bill and the measures that are being taken from cradle to grave are going to change life as we know it just now. Baptisms are already on hold, weddings have been postponed, attendance at funerals and those final farewells is going to be restricted to a few loved ones. So these are extraordinary powers, these are unprecedented times, but our job here is to do everything we can to support our NHS, to uphold democracy, provide that ongoing scrutiny. And my appeal to my constituents, to my friends and family, is that our NHS needs us like never before. We need our NHS like never before, and we all need each other like never before. So please stay at home, protect your loved ones and help to save lives.
Adam Tompkins, up to 4 minutes, please.
Thank you, Presiding Officer. I want to reflect a little bit in these remarks on the nature of emergency power and human rights. And Ruth Davidson talked about John Stuart Mill. I'm going to go even further back and start with Cicero. In times of emergency, Presiding Officer, necessity becomes the only test against which we judge the laws. Our usual standards of reasonableness or proportionality do not apply. If there really is an emergency, we do what is necessary to defeat its causes and to manage its consequences. And when I say we, I do not mean only the government, I mean all of us. Every citizen has a duty to do what is needed, in the old language, in defence of the realm. Or in short, we, all of us, do what we need to do for the public good. All of this applies, Presiding Officer, only if there genuinely is an emergency. We are only too familiar, unfortunately, with governments claiming the need for emergency powers when there really is no emergency at all, just an opportunity. But that is emphatically not the case here. There is no doubt that we face the gravest threat to public health and the gravest threat also to our economic health and well-being that we have seen in our lifetimes. And there is, of course, concern about the scope of the extraordinary powers that this bill contains. Powers to ban events and public gatherings that impede our freedom of movement. Powers to detain those who are suspected of being infectious, which are a significant interference with our right to liberty. Freedom of movement, freedom of public assembly and the right to liberty are modern human rights. Are our ancient conventions that come from Cicero about necessity and emergency powers negated by modern human rights law? Well, no, Presiding Officer, they are not. Indeed, they are accommodated within our modern human rights law. Properly understood, there need be no conflict between emergency powers and human rights. For example, one of our most fundamental human rights is the right to life. It's in Article 2 of the European Convention, and it's enshrined, of course, in the United Kingdom's Human Rights Act. It's a powerful right because it imposes broad-ranging and wide-sweeping duties on governments and public authorities, duties to protect life. In an emergency such as this, if it is necessary to detain infectious persons so as to protect life, so be it. Likewise, if it is necessary to ban events or public gatherings in order to protect life, so be it. In a public health emergency, these are best understood not as interferences with human rights. They are steps necessary to take in order to preserve the fundamental right to life itself. None of this means that there is no more rule of law. None of it means that we throw our critical faculties out of the window and stop scrutinising government. And none of it means that ministers or anyone else has licence to act arbitrarily. But it does mean that the standard against which we must judge the legality or the prudence or the propriety of government actions and decisions changes. In a crisis, in an emergency such as this, that standard is strict necessity. The question is not, is this a reasonable thing for a government ordinarily to do? The question is, does the government need this power? And seen in this light, Presiding Officer, the issue of how long these extraordinary powers should last becomes, I think, somewhat axiomatic. They last for as long as is needed. If they are necessary, they persist. And as soon as they cease to be necessary, they must lapse and be repealed. None of us knows how long the coronavirus crisis will last. So let us not get overly fixated on sunset provisions or arbitrary time limits on these statutory powers. These powers are necessary now. They are necessary for the time being. They will continue to be necessary for as long as the crisis endures. And for all of these reasons, we should all back them today.
Just before I call the Cabinet Secretary, I should have said earlier that you should note that decision time has been delayed. It may be you've noticed that already. And it should be around 5 o'clock. So I now call Michael Russell to wind up in this debate for about 5 minutes. Please, Cabinet Secretary.
Thank you, Presiding Officer. And can I thank members for the very constructive nature of the debate this afternoon. I will try to get through quite a number of the points that were raised, if you will bear with me. Can I thank, first of all, Bruce Crawford and the committee for taking evidence this morning. All of us who are members, were faced, I'm sure, this weekend by a tidal wave of concern from our constituents, from the people we represent. For each of us, it will have been different according to the constituencies. For me, it was the issue of access by ferries to any of the 23 islands that I represent. But others, I know, were dealing with issues of mobile homes, issues to do with staff accommodation, issues to do with protective gear. And our job is certainly to provide information, and we will continue to do that in the weeks and months ahead, I have to say. But our real job is to give leadership, is to ensure that we are leaders within this situation, and people are, if not comforted or not even reassured, but they are given what they need by those that they have elected. So I'm very struck by some of the contributions today, the contribution from Ruth Davidson, from Adam Tompkins, from Willie Rennie, and I rarely speak about being struck by their contributions except in a negative sense, but on this occasion I'm going to be very positive about it. Because they were talking about the issue of trust, and Ruth Davidson used that extensively. They're talking about the appropriate responses that we would give, and Adam Tompkins was talking about the necessity of the job that we are undertaking and how we have to undertake it. But Willie Rennie, I think, had the last word on this, and I know he loves to have the last word, so he'll be very pleased about this, when he said that he looked forward to the time when we did not need this legislation. And I think it's important as leaders and as this government to say very clearly that we wish to let go of this legislation at the very first appropriate moment, but not a moment too soon. And therefore necessity has to be the watchword. We will have to have this legislation for the period we need it, and we have to all live up to the trust that the people of Scotland, our individual constituents, will put in us and are putting in us now by watching and listening to what we're saying. Can I respond to some of the detail that we've heard? And there have been a huge number of detail points, so I won't get through them all, but if people have more, get in touch with me, email me. All the ministers are willing to respond, and I know Jean Freeman has said, for example, in points that Alec Rowley made, that she's happy to respond to you on those detailed points. First of all, can I say that in terms of Bruce Crawford's point of the switching on and off of the powers, if you look at Schedule 22, for example, very clearly it says that the switching on of the power comes from the declaration of the incidence of transmission of coronavirus, that it constitutes a serious and imminent threat to public health. That's a trigger to switch it on. And the trigger to switch it off is when that no longer exists, and that comes from the Chief Medical Officer, and it has to come from the Chief Medical Officer. And throughout the bill, there are those triggers and those switches, and we need to be aware of them, and the bill gives them. And in terms of parliamentary scrutiny, then, we need to make sure that that is built into the new bill and acts retrospectively on this one. Now, I'm not actually in favour of a 3-month reporting period. I'm in favour of a 2-month reporting period. No, I'm sorry, I really don't have time, Mr Finlay. I've got to get through this. I'm in favour of a 2-month reporting period, and I commit myself to that. We'll put it in the legislation. And I have already said to officials today, I've been working incredibly hard on this bill, and Jenny Gill-Ruth has also been working hard on this bill. We have to make sure that we have a schedule of reporting, that people understand what we're reporting, why we're reporting it, and what it means. In terms of food stocks raised by Patrick Harvey and also by Pauline McNeill, I wish we had the power to deal with price gouging, but I am pretty certain that that is a power that's reserved to Westminster in terms of trading standards. But what we do have a power, I think, already to do, and Mr Harvey raised this morning, was to purchase food if we require it, because we already do so for food banks. So I'm checking that out. But I do hope that that power already exists. And if there are powers that already exist in statute, then we should be saying to people, there they are available if we need to have them. I need to make sure that, and Willie Rennie's point about care assessments, just to reassure him, the provision in the bill is not an excuse for local authorities not to act. It enables local authorities to act quicker than they might otherwise do under the existing legislation. But that is a power we need to keep an eye on, because no authority should use it as an opportunity not to do something. Just in terms of other ones, I have to say that in terms of the escalating prices, I've dealt it. And Anna Sarwar asked not just 1 point, but 5, I think. In fact, we're probably 6. I probably missed one. So very briefly, just to acknowledge his industry as well as his inquiring mind. First of all, that the reporting issue will be 2 months, I've said. On creation, the legislation on cremation already means that those involved in cremation have to take account of the faith or belief of those who are cremated. This bill emphasises that point and does not change it. So I think we can look, and I heard his earlier question to the Justice Secretary, we can look to give reassurance on that. The UK government, we will be involved in UK action on supply chains, and indeed I heard the Scottish Grocers Federation making that point on Radio Scotland this morning. In terms of the Mental Health Act, we have to act very sparingly indeed. And these provisions are very extensive provisions, and many of us are uncomfortable with them. I know that Angela Constance, with her experience in the mental health professions, raised this issue in the committee this morning. We will ensure they are sparingly used, but we will also make sure that we report on their use so people know that they are there. In terms of human rights, I have spoken with the Scottish Commission on Human Rights. We are continuing to listen to them. We are talking to them about the best practice in drafting the new bill, which we will discuss with opposition spokespeople this evening, and will continue to do so. And just to make sure that we will keep under review the PVG issue. That is also a very sensitive issue, and I speak as the former Cabinet Secretary for Education. We are aware that that is a vitally important service that keeps children safe. We will keep it under review, but there's no intention to weaken that service, but we may have to streamline the service if that is eventually where we end up. Presiding Officer, this bill is a difficult bill. It's a bill full of detail. It's a bill that requires to be done now. I go back to where I started on this. I very much look forward to the day when this bill is no longer necessary and we can put it behind us. But it is necessity that will drive us. And in those circumstances, I do hope everybody will support this. But moreover, we'll continue to work with the Scottish Government as the offer exists and as Alec Rowley has acknowledged this afternoon to make sure that not only can we get the emergency bill we're already working on and for which we hope to bring to the Chamber for a single day next week, but we will then have to take forward some other legislation as well as gaps occur. And also, and this is the third time I've referred warmly to Willie Rennie, so I think that's the end of it today, but just also to make the point that he made, which was we need to look at this bill and its operation and say, are there things that we need to change we didn't get right, or we actually need to build on, and we'll try and do that in further legislation as we require it. And, Presiding Officer, I did move the motion early on, but I do it again just to be certain.
Thank you very much, Mr Russell. That concludes our debate on the UK coronavirus bill. Now we're going to move on to the next item of business, which is a debate on motion 21327 in the name of Ben McPherson on the local government finance order. Now I'll let Mr McPherson come down to the front desk if he wishes. Front bench. Thank you very much. So our next item is a debate on Local Government Finance Order, Scotland Order 2020. I would invite all members who wish to speak in this debate to press their request to speak buttons, and I call on the Minister, Ben McPherson.
Thank you, Presiding Officer. The purpose of today's short debate on the Local Government Finance Order is to seek Parliament's approval to update the guaranteed allocations of revenue funding to individual local authorities for 2020-21. Originally approved by Parliament on the 10th of March. Last week, the Scottish Government took immediate action recognising the challenges faced by businesses as a result of the COVID-19 outbreak by announcing a package of support worth £2.2 billion to limit the impact on Scotland's business community. The package of measures include 100% rates relief for all retail, hospitality and leisure properties, and this will result in Scotland's local authorities collecting significantly less non-domestic rates than they could have expected. Legislation dictates that the distributable non-domestic rates income cannot be changed after the 1st of April, which is why we are having to rush through this debate this afternoon. Any additional funding being provided to local government as a result of the COVID-19 outbreak will be provided separately and is not included in today's order. Presiding Officer, it is important to note that the Scottish Government will continue to guarantee each local authority the combined general revenue grant plus non-domestic rate income. In view of this, the purpose of today's order is to reduce the distributable non-domestic rates by the £972 million being provided by the Scottish Government to Scotland's businesses, with a corresponding increase in general revenue grant. I can also confirm that any additional loss of non-domestic rates income resulting from the adverse impact of the COVID-19 outbreak will be compensated for by the same increase to the general revenue grant, and therefore at no detriment to local government. Today's order seeks Parliament's approval for the distribution and payment of the same £9.9 billion as debated on the 10th of March. This £9.9 billion is a combination of general revenue grant that has been increased to £8 billion and the distributable amount of non-domestic rates income, which has now been set at £1.9 billion. The total funding from the Scottish Government to local government next year remains at £11.4 billion, but the split between general revenue grant and distributable non-domestic rates has changed considerably. The key point is that each local authority will receive exactly the same guaranteed total funding package as approved by this Parliament on the 10th of March. And I move that the Parliament approves the Local Government Finance Scotland Order for 2020 and urge everyone to support it.
Thank you very much, Minister. Can I call on Graham Simpson?
Thank you, Presiding Officer. When I saw this was coming up, I did feel it was like Groundhog Day, and I thought we've already debated this, haven't we? And I seem to recall it was quite an unexpectedly entertaining debate, and it was all about the overall funding package for local government. So we've covered that ground, but as the Minister has explained, the reason we're here today, it's a technical reason, and it's a very important reason, all to do with COVID-19. It's around giving the flexibility to give local government the same amount as it would have got, but in different ways. And so, Presiding Officer, you'll be pleased to hear I'm not going to take up any more of your time. This is not controversial, and we'll be supporting it.
Thank you very much. And I call on Sarah Boyag.
Thank you very much. I was told we had 3 minutes, so in time-honoured tradition, I have probably got 5 minutes in my speech for today. I also support this order going through today. It's absolutely crucial that our local authorities continue to have the funding to enable them to deliver services in what is an unprecedented crisis. I do want to thank our local government colleagues for the feedback they've been giving me over the last few days, and I know that they have lots of concerns about making sure that the social care sector is supported, particularly social workers. There's a particular issue about access to PPE for social workers. So if I can put on the record that we'd be keen to get feedback from the Scottish Government on what it can do to assist local authorities. I don't expect the Minister to answer that just now. I would have asked the First Minister earlier. I've also been made aware of concerns from Inclusion Scotland that vulnerable and disabled people and their carers have already lost their social care support with no notice as a result of the coronavirus. So this funding and this guarantee of funding is absolutely crucial for our local authorities to enable them to continue not just to provide key services that we take for granted, but in different ways like waste services, like our education services, but also for putting in place new services and for working with the third sector to enable our constituents to be supported over the next few weeks and months of this crisis. So can I just finally ask the Minister to confirm that he will work with his local government colleague, Kevin Stewart, the Minister, to respond to local authorities when they ask for help, to review progress, to ensure that vital services continue, alongside new support being developed for the third sector that was announced in the community statement last week. So we very much welcome this statement today. We will be supporting it at decision time. And even if the Minister can't answer my question today, I'd be grateful for an update afterwards. Thank you very much, Presiding Officer.
Thank you very much for that 5-minute contribution. And I call on Andy Whiteman.
Thanks, Presiding Officer. I'll be brief as well. As the Minister acknowledges, this is a technical requirement which obviously we'll be supporting. I just want to use the opportunity to say a very big thank you to all those who are working in local government. This has been a big surprise for them, quite a shock to the system. Local government operates a complex network of services on the front line for the public in Scotland, and logistically it is posing huge challenges. So I want to pay tribute to everyone who's working extremely hard in these very, very difficult circumstances. I also want to note the emotional toll that it's taking on public service workers right across the public sector, because of course they're also at the same time increasingly dealing with family issues, whether that's children out of school, or whether it's loved ones who are ill, or whether it's those relatives who need care. And finally, of course, we have the substantial financial challenges that we'll all face over the next months. Yeah, nothing really more to say. This is not really a debate. We will be supporting the motion. Decision time. Thank you.
Thank you, Mr Whiteman. And Colin Willie ready.
We support this emergency measure. Councils need the finance to deliver the new policies and laws that are being passed at a great pace by this government and by this Parliament. It is astonishing that the rate that new government policy is being developed, and we have to commend the officials for the work that they are doing to develop that, and also to the councils who are having to turn that into practice in many cases to make sure that sometimes incomplete policies are delivered in practice. So there will be a number of issues that will be thrown up as we develop that new policy into practice. Businesses that perhaps have a rateable value between 15 and 18,000 and might have looked forward in England to particular grants of £25,000 find they're only going to get £10,000 in Scotland. Not a massive issue in the context of the scale that we're dealing with in the crisis, but something I hope that the Minister will be able to reflect on in due course. Businesses working in the hospitality sector discover that they are actually not considered as hospitality, such as the Kingsbarns Distillery in my constituency, that perhaps losing out on quite significant support that keeps them going. So there are a number of issues that are being thrown up. Equally so, whether key workers will have their childcare costs covered in full as a result of the policies that are being passed, something that I'm sure they would find comforting if that was to be the case. At the end of this, we're going to be dealing with an awful lot of a financial legacy that we're going to have to try and clean up. We've got an awful lot, we're going to have to find a way of paying for all this in the end, and I hope that there is a review mechanism for local government, so that when we look at the end of this crisis at how different parts of government have fared, that we do actually consider whether local government have had the right finances at the right time. Because councils need to make the right decisions now without worrying about whether they've got all the money that they need to make it happen. So I hope there is a review process at the end of that to consider these important decisions. Thank you.
Thank you very much. And I call on the Minister, Ben Macpherson, to conclude in this debate.
Thank you, Presiding Officer. The pandemic that we are facing, of course, is disrupting lives like never before, and a key priority and focus of the Scottish Government, in partnership with local government, and I too also want to thank local government at this point, will be to ensure our communities are supported and protected as much as we possibly can under the current circumstances. Within the local government finance settlement, the Scottish Government will provide local authorities with a total package worth £11.4 billion, as I said. But as we know, this is only going to be part of the overall funding we will be providing to our local government partners and the wider business community. We have already announced an additional £350 million fund to support our communities, alongside the £2.2 billion package of support for the business community. And working with local authorities and the UK Government, we will continue to respond at scale and at pace to further support the people of Scotland, and particularly those most at risk. Presiding Officer, I would just like to say thank you to parliamentary colleagues for the unanimous support for this local government finance order that's been stated. This will help show our local government partners and wider Scottish community that the whole of Parliament is working together through this unprecedented crisis to ensure our local authorities can continue to support and protect our local communities in the coming weeks and months. Thank you.
Thank you very much, Minister. And that concludes our debate on the Local Government Finance Scotland Order 2020. Now, we've got a number of orders and motions to proceed through, but before we come to decision time, I would like to say a few words to members. Colleagues here will have seen the reduced parliamentary business schedule that we're about to vote on, which means that after today, the Parliament will not sit until next Wednesday. Parliamentary committees are similarly reducing their schedules. That is the right thing to do as we implement the public health advice and play our part in fighting COVID-19 and keeping our staff and constituents safe. However, can I reassure members that the situation is being kept under constant review, and I and our officials here will continue to liaise closely with the Scottish Government and all the political parties to keep you fully updated. I would also make the point that parliamentary scrutiny will continue, just as I know you all remain available to your constituents via telephone, email and other channels. I remain contactable to members directly and through my private office. We will take all necessary steps to keep people safe, but we will also, as members and as a Parliament, continue to function at this vital time. Now, we're going to move on now to the next item of business, which is consideration of a legislative consent motion. Could I ask Humza Yousaf to move motion 21315 on the Air Traffic Management and Unmanned Aircraft Bill?
Move, Presiding Officer.
Thank you very much. A question on that motion will be put at decision time. The next item is consideration of SPCB motion 21330 on reimbursement of members' expenses scheme. And could I ask Andy Whiteman, on behalf of the Scottish Parliamentary Corporate Body, to speak to and move this motion?
Thanks very much, Presiding Officer. This motion, on behalf of the Scottish Parliamentary Corporate Body, provides for an amendment to the members' expenses scheme, which will provide additional flexibility to the corporate body in order to support members as much as possible in these exceptional circumstances. I move the motion in my name.
Thank you very much. And the question on this motion will be put at decision time. The next item is consideration of business motion 21343 in the name of Graham Day on behalf of the Bureau setting out changes to next week's business. Could I call on Graham Day to move this motion?
Move, Presiding Officer.
Thank you. And no member has asked to speak on this motion. The question is that motion 21343 be agreed. Are we all agreed? Yes. We are agreed. The next item is consideration of business motions 21333 and 21334 on the extension of a stage 1 timetable for 2 bills. Could I call on Graham Day to move these motions?
Move, Presiding Officer.
Thank you very much. No member has indicated they wish to speak. Therefore, the question is that motions 21333 and 21334 be agreed. Are we agreed? Yes. We are agreed. The next item is consideration of 7 Parliamentary Bureau motions. Could I ask Graham Day on behalf of the Bureau to move motions 21335 on designation of a lead committee and 21336 to 21341 on approval of an SSI?
Move, Presiding Officer.
Thank you very much. And they'll also be put at decision time. So we turn now to decision time. The first question is that motion 21322 in the name of Michael Russell on a coronavirus bill be agreed. Are we all agreed? Yes. We are agreed. The next question is that motion 21327 in the name of Ben Macpherson on the Local Government Finance Order 2020 be agreed. Are we all agreed? Yes. We are agreed. The next question is that motion 21315 in the name of Humza Yousaf on the Air Traffic Management and Unmanned Aircraft Bill be agreed. Are we all agreed? Yes. We are agreed. The next question is that motion 21330 in the name of Andy Whiteman on reimbursement of members' expenses scheme be agreed. Are we all agreed? Yes. We are agreed. And I propose to ask a single question on the 7 Parliamentary Bureau motions. Does anyone object? That's good. So the question is that motions 21334 to 21341 in the name of Graham Day on behalf of the Bureau be agreed. Are we all agreed? Yes. We are agreed. And that concludes decision time. I close this meeting.
How do you mean no more commission? Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was balanced on. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
The work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.